Today I'm just gonna talk about my step 2 prep, and I want all of you to be able to ask your questions. Last time I finished my step 2 was on Tuesday on August 8th, and I know I went live, but not a lot of people were able to ask all their questions. So I'm giving the opportunity to anyone who was not able to join to ask their questions, any question that is bothering you. If you are prepping for step 2 and you have any questions, just feel free to ask your questions and I will answer them. Yeah, so you can join me. So in all, I'll say I used about 6 months to study for step 2, and for step 1 was more rough, I'll say. So with step 1, I used over a year to prep. Like I started with prelims, and like I made a lot of mistakes, but yeah, I had to restart everything all over, and I made a lot of consultations, and I'm making this video so that like people don't make such mistakes that I made, and hopefully you can learn something from this video. Yeah, so if you have any questions you can ask me. Thank you, Flight Doc. Yeah, so you are welcome to join live, and then you can share this video with your friends so they can also join me, and then they will ask their questions if they have any questions that might be relevant to their step 1 and step 2. I'm ready to answer any questions that somebody might have. So when we are prepping for the USMLE, usually we have a lot of questions that. So Flight Doctor asking, were you able to do some or all CMS forms? So with the CMS, I did not do all. I intentionally did not do all. I was also time constrained and I didn't begin them early. So generally, I would say I did at least three forms for each of them that has up to 3. So with the pediatrics, I did about 3. Medicine, surgery, all of them I did about 3. I think I don't know if they have for psych, but if they have for psych, I did not do for psych separately. So it was medicine, peds, and surgery. That's what, and then OB. I also did the CMS form for OB. OB, I think I did 2. And I mean, they are expensive, like $60 for each of them. And then like, this CMS form, they are just prepping you, they are just giving you a different perspective of the exams, and then a different way NBME also sets the questions. Some of the questions are such that you might see them again. For example, like if you see a question on thyroid nodule, there's no other way that they can ask it. There's no other way. So if you see questions on thyroid nodules on the CMS form, take them very serious, because in your NBMS is the same way. If it's hypothyroid, if it's hyperthyroid, like, and then it's a nodule, it's only one way they can ask it. So for those kind of questions, strategically, I can say you should master them the way NBME treats them. But some of the other general topics, there is no other, like they don't even repeat, they don't show up on the exams. And then my exam wasn't like straightforward from the CMS forms. I could have still passed without doing the CMS forms. I don't think the CMS really added anything new to what I knew. It only built my stamina, but nothing real, like, because I did the CMS forms like about 3 months to the exams, and I didn't remember anything vividly from the CMS forms. So if you don't do CMS, it's not a problem. You will be fine without CMS forms. There's nothing so special on the CMS forms. I would say make sure you do all the NBMEs, all the 4 forms. I did all of them. Make sure you do all of them. NBME 9 and 12 are kind of rough. They were rough for me. NBME 9 I didn't do really well, but it was like NBME 9 was kind of like a wake-up call for me to tell me, hey, you are too relaxed, like you need to read into the questions, you need to be serious when you're taking NBME. So NBME 9 was more like a wake-up call for me. But with NBME 12 was also that bad for me. I don't like the way, okay, well, the questions were nice, and I woke up at midnight. I wasn't prepared for it. Like I woke up at at 3 a.m. I slept like around 11, and then I woke up at 3 without planning to do the NBME. So I just got up and I said, okay, what if I'm in the hospital and I'm called to attend to a patient, and these cases are the cases on the down NBME 12. So I just got up and did it, and I was still sleeping all that. But hey, like, I wouldn't say that is the excuse for me to get a low score, which was 225. But I reviewed them quickly because it was 2 days before my exam. So I reviewed only the incorrect ones within, I think I used about 3 hours to review them real quick. Some of them, like, I did like some mistakes that are avoidable. Yeah, so yeah. So let me see your question, please. Let me see who is asking. Okay, so let me see this. So flight doctor said, I'm currently going through some CMS forms, which is a great thing. Keep doing your CMS forms. If you have enough time, do them and pay attention to especially endocrine, because endocrine, there's only one way the question can be asked. Like, even if you go into the exams, it's only one way. So pay attention to endocrine. OB, also pay attention, because some of the algorithms that UWORLD uses, NBME doesn't use the same thing. So pay attention and do comparison to UWORLD. If you see anything, compare it to UWORLD and get the difference between how NBME wants you to approach it. Let me give you this example. Like, when I was doing thyroid nodule question from the NBME, what they did was that when anytime I even came up with a mnemonic, it might help some of you. So my mnemonic is NBLR. So that if NB, if you have the TSH is normal, N for normal, if the TSH is normal, then we want to do biopsy. But if the TSH is low, which is LR, low TSH means that we want to do radioactive thyroid scintigraphy. So my mnemonic is anytime TSH is high or normal, you do biopsy. But NBME wants you to put it together this way: ultrasound guided fine needle aspiration for biopsy. That's how NBME wants its answer. So UWORLD doesn't want it that way. UWORLD will separate it, like do ultrasound first, then next they'll say do fine needle aspiration, and then next they'll say do biopsy. So you want to take note of those differences. So take note of that. So the mnemonic again is NBLR, but N for biopsy, N for normal TSH biopsy, LR, NBLR. LR for low TSH means R, that is radioactive. Okay. And also if it's high, normal and high are the same. So normal or high, you do biopsy. All right, let's go back to this. So yeah, go through your CMS forms, flight doctor. My step 2 CK is on September 9. September 9 is almost around the corner, and I don't know your schedule, but at this time you should be doing more of your UWORLD flashcards. You should be doing more of your UWORLD flashcards, and then that should help you. But the CMS forms, honestly, I wouldn't say I actually saw anything that repeated from the CMS forms. So for me, if I were to take my exam in 2 weeks, I wouldn't be doing CMS forms at this time, but I'll be doing UWORLD, my very weak areas, and also doing some the weak areas from my not the CM, I mean from the NBMEs. Okay, now let's go back. Thank you. So years 9 and 12 were crazy. Of course, NBME 9 and 12 were crazy. So I opted to take NBME 12 last week. Yeah, that is perfect. Take last week and review your incorrects like very well, and you might meet certain things on the exam. Seriously. So next is flight doctor. Yes, thyroid. Just had one FINAC for thyroglossal that cyst. Move with. Yeah, of course. And next, do you think NBME 8 is worth doing after 10 and 11? I don't know if they had NBME 8, because I didn't do NBME 8. It was 9 for me. It started from 9. I don't know if they have it offline. If they have it offline, for me, I didn't do it. I did everything online, so I didn't see NBME 8. It was NBME 9 to 12. So yeah, it's offline. So if it's offline, you might want to do it, but you have just few days. It's on 9th September. Today is 4th September. You don't want to go do that. Just do the offline one. Don't sorry, just do the online ones. Don't do the offlines, because it's gonna change your strategy. I mean, your speed for the exams and all that. You want to simulate the real deal exams, the real day exam, because it's very, very stressful. It was kind of stressful, but I think my step one, I didn't use glasses. My glasses made a difference, and I also got eye drop. So anytime I went out, I would put an eye drop, eat something, and come back. And I made sure I took a break for after every block. So after every block, I went to the bathroom. At least went to the bathroom and then sip water and come back immediately. So something like that. So my eyes were not so like stressed like that. Like step one. Step one was more horrible for me. Now let's see. Yes, flight doctor. Okay, I'll stick to 10 and 11. Yeah, stick to 10 and 11. And if you get to do 12, just make sure that you're incorrect. Pay attention to it. Pay very close attention to your incorrect. Yeah. Amazing. I still can't imagine sitting through. Yeah, it was 316 questions. 316 questions for me. So I think the first 6 blocks were 40 questions each, and then the last 2 were 38 questions, and 8 times 2 is 16, right? So it was 316 questions for me. Hey, but you will do it. Like when I was getting to when I was getting to the day of my real deal, I also thought the same. Like I was like, hey, can I sit through 9 hours? But hey, you sat through step 1, so yes, of course you can do it. Yeah, by the time I realized it was 5 p.m. and I was coming home, I started from like 8:30 and I left like 5 after 5, a little after 5. So it's very doable. And after step 2, I didn't feel like that panicky as step 1. For step 1, I had a feeling I'm going to pass, but I don't know what I'll get. But for step 2, I don't even have that feeling. I don't even think about it. I don't think about it. I'm just hoping for a positive result, but I don't really think about it. I don't think about it that much. Yeah. Let's see if someone has another question. Yeah, congrats, first of all. Thank you, Carbotech. Thank you. Yeah, so Flight Doctor again is saying, when did you when did I take the free 120? So free 120 was, oh my God, where's the paper? I think I kept it somewhere here. Free 120 was less than, I would say like 5 days to my exam. Yeah, I would say like 5 days to my exam was free 120. Free 120 was about 5 days to my exam. So yeah. And I did it from the prometric center, because sometimes when you go, there are a lot of things that can work in your favor. One, the people know you, so they are used to you, also used to them. And when they even called me to tell me that my exam is the next day, they asked me, you were here last week, right? And I said, yeah, I was there. So that is something like it releases anxiety. And also, during when you're doing the free 120, like for example, when I was taking my real deal, I used is it control and plus to maximize the screen size, right? So that the font size becomes bigger for me to see. But I realized that there was this lady who was also taking step, but she was struggling. I don't know, I wouldn't say she was struggling, but I mean, when I'm going out, I see that her writing is so small and so tiny, and I'm like, are you okay? Like, can you see that? Maybe her eyes are very good, but when you go to the center, you'll be able to like test the device and then see what font size works for you. You don't have to go figure it out on the day of the exam. Yeah, so all that helps. And also you get used to the environment. So that's the reason why I took it from the prometric center. I took the free 120 at the prometric center. The disadvantage was that I had to come back home and then like review it from a different, from like fresh questions. I didn't know exactly what I got wrong, like, but most of them I'm like, I have to try to remember what I got wrong. But yeah, but it's worth it. I got a 68% at the for the free 120, and then that also gave me another wake-up call that hey, 68% is not good, but I'm not going to change my date. I know I have what it takes to get better than that 68, but that is what I got on that day. And going into the exam, I need to be very careful. If I'm as comfortable as I was doing the free 120, then it's likely I'm going to get another 68 on the exam, and I'll come back with like 230 something, which I don't want. I want to go above 240. Yeah. So it was a wake-up call for me. Let's see if we have another more question. So he says, okay, when did you sit for the free 120? What percentage do you think would indicate passing comfortably? Yeah, 65 to 70 is good. I got 68%, and I knew I could do more than that, but that's what happened on that day. So yes, 65 to 70 is good. That's what a lot of people say. People say you should go above 63. If you check Reddit, they say above 63 is good. So yeah. So if you just joined us, I just finished my step 2 like last Tuesday, and I'm making this live video for my followers so that anyone who has any doubts, you can clear it. You have the opportunity to ask your question. Just type it in the comment box there, and I will read it out and respond to it. So feel free, and then type your comments for us, and then I'll be able to answer them. Feel free. And then you also kindly share this to other people who are studying. If you are in a group, just share the link into the group so that more people can join us. And then this will be a blessing to a lot of people. Before I took my step, like, it was, you know the noises that people make about USMLE, it's not doable, like some of us cannot do it, so like I'm trying to demystify that and also help people to be able to have a better view of the exam. It's more about determination and studying hard. It's not just about you don't know. Like, if everybody reads these books, if we all read these books and then read them consistently, we will be fine. It's all about reading. It might take somebody several years to read it, but at the end you must be able to read it. You should be able to read it. This is my step 1 book. You can see all how it has become messy. Yeah, I mean, I wasn't the most brilliant student in my class, but when I came out, I decided to write it, and then I wrote it. Yeah, I've done it. Yeah. Let's see more questions. So from who is this? Okay, where were you working at the same time you are preparing for the step 1? If yes, how many hours should you could study daily? Oh, so how many hours did I study daily if I was working? So yes, when I was studying for step 1, it was like this. So I was working in the hospital as a nurse, and there was COVID. I started, and then within a short time, COVID came out, and then there was COVID outbreak, right? So now there was more workload in the hospital, and my floor was changed. I was moved from the normal med surg floor to the telemetry floor, because most of the COVID patients on the hydroxychloroquine and all that, they can have like that long QT syndrome, so they want to place them on EKG. And then some of the people can also get like viral myocarditis and co, so they want to place them on EKG. So my floor was changed to a COVID floor with telemetry. So look, with the increased admission rate, I had to work like 5 days in a week, and each shift is 12 hours. So you can calculate it. So 5 times 12, yeah, it was like, so that's more like 60 hours in a week. And yeah, it was stressful because I was doing night shift, and I go at 7 p.m. to about 9 a.m. and I come home, and then I have to study a little bit. Like, I study until 12 noon, and then I'll sleep from 12 noon until 5. If I wake up early, I'll study a little bit before going back to work. If I don't, then I'll just go back to work. And at work, there's no way I can study because I have 5 patients under my care, and I'm the primary nurse, and I do everything for them. So like, this one is calling you for pain medicine. This one is calling you, I cannot breathe well. This one's EKG device is going off. This one's positive pressure ventilator is going off. So it's like you are just working the whole shift, and then you come back so tired. So it got to the point where I had to choose between my job, like what I am at the moment, versus what I want to be in the future. So I approached my manager and I told her, hey, I want to I want some time, like 3 weeks, in order to prep for STEP and write it. But she said, no, your agency does not allow that and all that. I'm like, okay, if they cannot give me, even I wasn't asking for free time, I just wanted to take my PTO at that time. It was overdue. I had a lot of PTO. I just wanted 3 weeks of it. They said they were not going to give me. So I'm like, okay, if you're not going to give me my own PTO, then I'll choose between what I want to become versus what I am today. So I mean, no, I mean, versus what I was as a nurse and then versus what I want to become as a doctor. So I just quit the job immediately. I put in my resignation the next day, and then I was allowed to go. So I quit my job, and then I stayed home from that time. Like, I mean, I quit my job. After quitting my job, I went to do a different job where the salary was more. Like, the salary was like maybe 2 or 3 times or what I was taking at the time. So I did that for 6 weeks, and I packed some money into my account. Then I came back home, and I sat home for 6 months. I think 6 months. That was just studies for 6 months without work. So it was more like that. So for me, what works for me is work hard, work everything, work your ass out. Like, work, like, if you can work 6 days in a week, work, and don't do a lot of studies, or just do little studies. Then when you save enough money to take care of your bills, then you can take off time without any work, without disturbance, and then you only study. So that's what I did. That's exactly what I did. So after step one, also I implemented the same thing. After step one, when I got my results, now I decided to find a contract job instead of a permanent job in a hospital. So I will work in this hospital for 6 weeks, go to the next for 6 weeks, go to another for 6 weeks, and then I make sure, like, I live within my means. I make sure I don't touch my salary. I just make sure. And then what I was doing was I was paying my car loan. So I finished paying my car loan within a short time, and then I saved some money to take care of my rent for the next 1 year. So, and then I came back and I stayed home from January until now. I've not been working, but I had some savings to take care of my bills. So that is what I did. I don't know if that works for you. It doesn't work for everybody because it depends on how much you are earning. But if it doesn't work for you, you don't have to do the same thing. But that's what I did that helped me. And I sat home from January until now without working, and I've taken step 2. So soon I'll be able to go back to work and maybe make some little money again. Yeah. So I hope that answers your question. Now the next question is coming from thank you, congratulations, thank you, from Leno Garcia. I need to improve my score. My step 1 is in 3 weeks. Any advice? I feel too anxious and I feel not prepared yet. So my last NBME was 53. Yeah, if you've done all the NBMEs, Lino, and then you're still not improving, one method I can suggest to you is that, I don't know if you've done this yet, but when you take your step 1, sorry. So when you take your step 1 and you go to the back, this page is called rapid review, right? This is rapid review. If you have not done this yet, go to the rapid review, and now you'll realize that they write, for example, low serum ceruloplasmin is for Wilson disease. So what you are going to do is that you cover this side with a sheet of paper like this, right? And then try to treat this as questions and write your own answers. After that, refer to this and mark them. Now, any topic that you get wrong, any one that you get wrong is your weak area. Now you can focus on that weak areas and improve your scores real quick. And you can use about 1 or 2 days to do that. And then you identify your weak areas real quick and then review them from the book real quick. And that can improve, can add to your scores, okay? I know you know a lot by now, but you just want to that confidence going into the exam. Yeah, I hope that answers your question, Lino. That is one of the quick fix that you can do, because your exam is within a very short time, and then like within 3 weeks. Yeah. Let me see. How did you review and memorize the maximum for step 1? Okay. So just as I talked to Lino right now, so I got to the point where I didn't know what to do again to improve my scores for step one. So I did exactly what I just told her. I did a rapid review and then I identified my weak areas. Now, when I identified my weak areas, I started making a flashcard for those weak areas for Anki, my personal flashcards, not the pre-made deck. So I made my own flashcards for that. And those topics that were hard, I would do B&B very fast, like increase the speed and review them very fast. And then that was helpful to me. And also, like with the flashcards, when I did them, those who have a lot of time, if you do the flashcard, just make sure you make time for your flashcards every day. Don't go 3 days without doing the flashcards, and that is not good, because you want to graduate from the flashcards before your exam time. So take them very serious. Flashcards help in space repetition, and they are very, very helpful. Yeah. And let me see, there are more things that I did, but as time goes on, I'll remember them and then let you all know about them. Here, so if you are just joining us, kindly share this link. I'm just answering questions with regards to step one and step two. If you have any questions that are bothering you, just go ahead and put it in the comment box and I'll reply to it. So Lino says, thank you very much. I'll do that. Thank you again. You are so welcome, Lino. You're so welcome. So, Mitul Patel, you're asking, you applied this year? If yes, then which specialty? So, yes. So I've started my application process. Yes, I did started my application process. I don't know. I cannot flip this camera. Let me see if I can do that. I'll show you all. Yeah, I started my application process for this. I have bought the ECFMG sorry, the token already, and y'all can see. Let me switch the camera and see if y'all can see. Yeah, I started this already. Yeah, if you can see, yeah, the application is here. As you can all see, Residency 2023 application, and my name is up there. Just like I cannot show my let me see if I can just show it a little bit so that nobody sees my ID. Let me see. Okay, yeah, you can see Jerry there. Jerry, that's me there, and then y'all can see it. So yeah, I'm doing application for this March, and then you want to know the specialty I'm planning to. So basically, I'm applying for internal medicine, but and family medicine. Those are the two that I'm applying for. Like, I've done a lot of studies. Like, I've been studying all my life. I'm 35 now, and I don't think if I want to do surgery, like I have that stamina to do surgery for 7 years, and I don't know how long I'm going to practice. Even like my eyes are worrying me already. So I'm just gonna do internal medicine, and then if I can specialize in something later, I can do that. Also, I can open my own primary care hospital and then or clinic, and then just manage it by myself, and then get some few doctors or nurse practitioners. Yeah, and yeah, that is the plan. So I'm applying for internal medicine and family medicine. Yeah, do you plan to give step 3 before? Yeah, I will do step 3 by January, February. I should be done with step 3. That's the plan. Yeah, that's the plan. So after my application, I'll start studying for step 3, and then I learned that helps a lot in the matching process. So yeah, if you're just joining us, we are talking about USMLE step 1, step 2, step 3. I just finished my step 2, waiting for my results. I have 2 more Wednesdays to wait, and then it should be out. And then when it comes, I'll update all of you. If you haven't subscribed, kindly subscribe, and also you can share our link with any group that you are in. Anyone who has questions that wants to ask, let them ask, and I'll answer them if I can. So now let's go back to the questions. So Carl Botek, please talk a little bit about the strategies you use to study with the study partner. How did you do UWORLD together? Okay, I'm going to flip my screen and I'll show you all how we did UWORLD together. If my UWORLD has not expired yet. I don't think it has expired yet. UWORLD. Yeah, so what happened was we did, myself and my study partner, we studied step 1 together. I met her after I started studying for step 1, Yeah, so we've been doing the step 1. We did step 1 together. We did step 2 together. Okay, so this is where what I did my second pass of UWORLD. I did only 43% of it. This is exactly what I did. I did only 43% of it. I hope you all can see. I did 43% of it. Yeah, let me see. I just want to be able to hold this well. Yeah, I did 43% of it. So let me show you. My study partner originally is from Canada, but anytime we are about to write steps, she comes to the US. So most of the time we study when she was in Canada and I'm in the US. So this is how we do it. So first we open the UWorld and go here. If you all can see, create, like that. And then maybe I'll choose unused and select maybe internal medicine. Let me go here, timed. Yeah, we did most of the timed mode at the end, but for the first pass we did tutor mode and we went subject wise. But now okay, let me just select this tutor mode and then unused, and then we can do this. So just select any subjects or any type of questions that you want to do, and what you do is, so I've selected 7 questions. Let me just select 7. And so when I put this in there, like 7 questions, right? Epidemiology. So when I do that, sorry, I'm doing it in my kitchen here. So if you all see my surrounding, don't worry about that. So I'll generate the test, okay? And now I'll come down here and suspend it. Do you see at the bottom here? I'll suspend the test, yes. Now, after I suspend the test, now I'll come here and put the cursor here, and the number, you see a test ID beside it. You see? So when you see this test ID, you copy it, and then when you copy this test ID, you are going to send this to your study partner, and she will open her UWorld and then go to create. When she goes to create, now she will come to custom. So let me copy that test ID first so that I show you all. So previous test here, yeah, it says copy, so I just copy it here, right? I've copied it, and so I'll go to create. So when you send it to your study partner, she will go to create and come to custom and paste it in here. Do you see that? So she'll paste it in here and then click on retrieve, and then all the questions will come here. All the 40 questions will come here. And then all she needs to do is to click here, generate. And then she will get the same questions that you set up. The same questions. And then you all can start. So when you finish, then you review it together. That is it. So I hope this answers your question. I hope this answers your question about how I started with my study partner. So we talk over FaceTime audio or Skype, and I hope this answers your question to discuss. Yeah. Okay, let's see. Now somebody is asking, let's go up because there are a lot of questions. If you are joining us, you can put all your questions down here, and then also make sure you share this link. Okay, share the link in your group so that your friends can also join us. We need more views. Now, let me see. So do you think FA step 2 CK is worth it? Personally, I don't want to be biased. I watched someone on YouTube and he said he read every page in this. It is worth it, okay, if you can read, if you have the time. But I feel like everything in this book is on UWorld. That's how I think. Everything is on UWorld. So what I did was I read, seriously, I used only about 4 pages in this book. I bought a book, but I used only 4 pages in it. So for me, I cannot say it's not worth it, but all I will say is that I did not use it. Now, mostly I used this book. I went back for my step 1 knowledge. Very important. So I used the step 1 book more than the step 2 book for my step 2 CK. And most of the information are in the UWorld. Yeah, and then UWorld, you want to master the tables, because the tables gives a more perspective, like where maybe UWorld will ask one thing from that table, but it gives you the table to learn more things. So what I did was that I used the tables for my personal Anki flashcards, and then every night I'll spend about 4 hours doing flashcards, and sometimes I'll go to the park where people are walking and I'm also walking doing my flashcard at the same time. Or sometimes I'll wake up midnight, like from 1 a.m. to 3 a.m. in the basketball court, just be there and then be walking around the court and be doing my flashcards. So I hope this answers your question about whether the book is really worth it. It's not a must. I also had this one. People used to talk about this online med ed. Okay, I'm not trying to talk against any resource here. Okay, if it works for you, works for you, but I did not use it. I had it here. I didn't use it. The only thing I used was the medications for acute coronary syndrome, Monarch C batch. Monarch C batch, that mnemonic. I learned that from him, which worked for me during my prep, but I didn't really go through every video of his, though I bought the book. Yeah. So someone is asking, like, okay, let's go up. We'll come to your question. Okay. So yeah, this question is repeating. Let me see, just so I don't miss this one. So for step 2 CK exam, was the exam heavily tested on social ethics questions as well? Do you feel UWORLD and NBME assessment is sufficient enough? So if you are talking of only social ethics, what I would say is that when you are in your last, let's say like last 8 days to your exam, I want you to go to Amboss, create a new account. If you cannot subscribe for a new account, create a new account, and it'll give you a free subscription for 5 days. And with that, you want to do this with your study partner so that it's faster. If you don't have a study partner, now when you get to Amboss, you click on you want to set questions, right? You want to create a question bank, but you have to select only the ethics. And then when you click on ethics, you will get 160 questions. Now, among those 160 questions, we have questions on patient safety, like all forms of bias. Let me see, I wrote them here. This was my last quick sheet from Amboss for the exam. So let me tell you what is on it. And most of these things showed up in the exam. Like, I'm not trying to disclose anything from the exam, but I'm just trying that this topic was on the exam. These topics were there for me. So you want to take them serious because they are on Amboss. They are on Amboss. You want to do the questions from there. So if you do them from Amboss, you get to the exam and it will be very easy for you. Do all the 160 questions. But myself and my study partner, we didn't do the last 40 questions. 160. We didn't do the last 40. We did about 3 blocks, and those 3 blocks were enough for me on the exam. So one, I think some of the things I wrote here, like I used to forget about, like when they say interstitial infiltrate, I used to forget that it's atypical pneumonia, like my brain doesn't catch it, so I wrote it down, like note to self. And anytime they say something is vesicle on the skin or in the mouth, it's viral. Like you're not gonna get it wrong if you choose viral. So something like this, I used to forget, so I wrote it down. And then I'll say on the exam, it was very helpful to me. Now, these are the things from like the biases. I don't know if I'm saying the word right. My English is not very good, but it's BIAS, bias. Oh, yeah. So availability bias, anchoring bias, visceral bias, framing bias, confirmation bias, omission and commission bias. And yeah, so with this, you want to pay close attention to these on Amboss. Do them very well, and then know the difference between them. In the future, I can make a video on them. So do them very well and do all the Amboss ethics questions like a week before your exam. And don't do it too early. You are going to forget. Don't do them too early. Safety, people say you should read, is it patient safety and quality and improvement? I would say don't read it. I didn't read it, but I was fine on the exam. You don't have to read it. Just do the questions and read the explanations of the questions. You will be fine. So I hope that answers your question. Now, if you're just joining us, kindly share this, subscribe to the channel, and ask your questions about step 1, step 2. And let me see, there are a lot of questions, and I don't want to miss anybody's questions, so I have to go up and take them one by one. So how you feel about ECFMG, or how you able to ECFMG certified? the time of 29th September. So for me, the only thing I'm left with now is my step 2 score, and also one more doctor to do my mini CX for me, the clinical evaluation, and then I'll get E7 certified, I think, by that time. So I should be fine. Now, is being E7 certified or verified same as certified? Which matter for ERAS? So yeah, you need to be ESFMG certified before the match process, not before the application. You can do the application, but then before the match, you should be certified so that the hospitals or the programs that are choosing you know that you are certified. But you can apply everything, but if you don't get the certification, then they might not accept you. So I heard it takes, that's the next question from Flighter, it takes just a couple of days to a week to get CFMG certified. So from those who I spoke to, they said about 2 weeks. About 2 weeks after you submitted your OET and your mini CEX, yeah, and then your step 2 is ready. It takes about 2 weeks. That's what I heard. Yeah. Someone said I emailed you for step 1 mentorship, but you didn't reply. So there are a lot of emails, and then usually if it came before my step 2, then most likely I was not able to reply. And I think I said that in one of my videos. I was like the step 2 took my attention, so I couldn't reply to a lot of emails from my from YouTube. Sorry. Now, any advice for first year med students? Yeah, so for first year med student, what I would say is some of us made mistakes by not conscientizing ourselves or like prepping our mind for USMLE from day one of med school. So if you know you are going to write USMLE in the future, the time is now. Start reading first aid, start doing questions. Okay, start doing USMLE questions now on topics that you are being taught. But hey, enjoy your first year. Like, just enjoy your first year of med school, and when you get to second year, you are really doing, if you are really doing like more of the things on the USMLE, then that's when you are really going to appreciate it. So yes, but there are some topics like anatomy and physio that you can see some of them. So if you started that, then I would say start prepping for the USMLE ASAP. Let's see, next question. Okay, next question is, he just took his step 2 CK exam. He was very busy for the past 2 weeks. Oh yeah, that is true. So I am presently, this testimony, I'm presently doing about 80 to 120 questions of UWORLD daily. I hope this is for step 2, but it takes me almost 2 hours to review a block of 40 questions, which is even too that's even too fast. Like, I don't know if you are privy to the questions already. 2 hours for 40 questions is too fast. Like, it's very, very fast. So if you are doing that, you are doing great. I just hope that you have enough time to be able to assimilate the information and take your notes and take your flashcards from it as well. What do you advise is a quick and effective method of to review faster? I wouldn't say you should rush it. If you know the topic, then moving faster isn't bad. But if you're not so familiar with the topic, what I did was I made Anki flashcards. I took my time, read, and made Anki flashcards. And now in the flashcard, what I'll do is I'll ask myself, maybe what is the difference between this and that? Then I'll take the UWORLD, the table, I'll take a picture of that as the answer. Then maybe sometimes I'll highlight something on the table to pay more attention to that when I'm doing my review. So take your time. If you have enough time ahead of you, take your time. If you don't have enough time, then you can speed it. But if you have enough time, do more flashcards from the UWORLD tables, and then you will be fine. When you come back and you are reviewing, you just glance through it and you are fine. Let's go to the next one. Congratulations. Thank you. Let me see. Okay, thank you. You're welcome. So again, Let me go to other people's questions. Yeah, do you know what the last date for the application for this year? Trying to apply for this year. I'm trying to apply for this year. I don't know about the soap much, but usually I think it's after the application. But for the last day, I'm hearing is 28th of September. That's what I'm hearing. Is it sometime in December? I'm hearing it's 28th of September. I'm not very sure about that, but that's what I'm hearing so far. Yeah, but there'll be other, I don't know about the, is it the MRNP application or something, or the other one, the soap application. I don't know about that yet, but I'm just hoping that they come after the application itself. So I don't know much about soap at this time, please. Sorry. Maybe after my application and I match, I'll be able to have more information on that. So pray for me, please. So next question: where do I get official practice tests for step 1 and step 2? When you say practice test, so we have NBMEs, whereby you go to, you log into mynbme.org, and then there you can see a lot of practice tests over there that are online. But if you want offline, just put it in Google. You should get them. You should get them. And then there's also this website called Med Student Zone. I think there are a lot of resources there. Med Student Zone. Just Google Med Student Zone. Google that, and you will see a lot of resources there. There might be a lot of information there. And also join the Reddit group, the step 1 and step 2 Reddit group. And if you have any questions, a lot of people are there to motivate you. A lot of people are there, and then they have the resources. So you just ask your question. Hey, how can I get free 120? How can I get free NBMEs offline? And there'll be someone always there to answer you. So join the groups. Don't just hide in your room studying. Join the groups, the Facebook group, and also the Reddit groups. Very, very helpful. The Reddit has been very helpful to me. Sometimes you can compare your scores to people there. If you are doing low, if you are performing very low, you'll find people who are performing like you but did better in the exam. So you can relate your situation with theirs. I'm sorry, let me just wet my lips. Okay, so if you are just joining us, I just did my step 2 last Tuesday, and I'm trying to interact with people. A lot of people had questions for me, and I'm giving opportunity to them to ask, and I answer them. And you can also share this and share the link with people so they can join us, and also kindly subscribe to this channel for more interesting videos. A lot of people said they wanted my mnemonics that I used. Yes, I will make a video for you guys on some of the mnemonics, and maybe in the future also I'll do a live video for the mnemonics, so that if you join the live, then you can be able to catch those mnemonics live, and then you make your studies better. We are all still studying. I'm not perfect. I'm still a student, still studying, trying to become a very good doctor. So I'm still open to a lot of discussions, and I want to study really. Okay, let's see if there's any more question. So Robin Hood, one more question. Do you recommend Amboss questions for step 2? Also those CMS forms. Hey, Robin Hood, like if you have time for Amboss questions, perfect. But if you're time constrained like I wouldn't say do Amboss. The only thing that I will beg you to do is when you are like a week or 10 days from your exam, find some time to do the 160 ethics question from Amboss. UWORLD does not cover that. So on the exam, what I realized was that UWORLD ethics isn't enough at all. Like UWORLD ethics, I didn't see anything in the exam that was related to UWORLD ethics, but Amboss ethics and quality assurance and patient safety, like those topics, oh my god, like they were just on the exam like that. And then like, so you want to do the ambos questions. Don't waste so much time reading everything on the quality improvement and patient safety. Just do the questions and read every bit of each of the explanations that will be given, and then you should be fine. Yeah. Let's see if there are more questions. Let me see. You kindly share the link for us, put them on your WhatsApp status so that people can join us, and also share them in your Reddit, subreddit, and also Facebook, so that people can join us. Call your friends to join us. Let me see the next question, if there is any. Yeah. Okay, so the next one is saying, so how were the step tests compared to MCAT? My friend, he likes studying for step more because there was more good results for these tests. Okay, so with the MCAT, I don't have information on that. I didn't school in America. I didn't do my med school in America. I'm an IMG, so I don't have any information on that MCAT. But I don't think MCAT is like, it's different exam. It's an exam that they write in order to gain access or admission into the medical school. But after you enter the medical school and you want to become a doctor, then you write the step 1, step 2, and step 3 in order to march into residency for training to become an independent doctor. So they are kind of different. MCAT is like you're now seeking admission into the med school, and after you enter med school, you are now wanting to become a doctor. Then you write the USMLE step 1 and step 2 and 3. Now, next one from Carl Botek. I did 63% of my UWORLD step 1. Do you think I can take an NBME at this point? Of course, you can take an NBME as a baseline to see where you are at. And then you can do that to see where you are at. But if you do it, don't stress about your score. You might do very well, you might not do as you want to do, but don't stress about it. If you do very well, do not feel too comfortable. Keep reading, because one very good assessment is not enough to say I'm doing well. It could be an outlier. So just keep reading, and then you should be fine. So you should have taken one NBME already. It wouldn't be bad. If you have enough time, let's say you have about 1 year or something, and you don't want to waste it now. Take your time and continue to about maybe 80%, then you can take an NBME. Now let's see the next question. Next question says, for Somalia, please tell us the best way of reading USMLE first aid. From Somalia, I'm sorry. From Somalia. Okay. All right, so that tells me that you are studying for step 1 from Somalia. That tells me you are studying for step 1, because you're now asking about how to read the first aid. So let me tell you a little something small about myself. So when I bought this book the first time, what I did was I took it to the library, and I don't know what sent me to Renal. I went to Renal, and I opened Renal, and I read Renal very well, like everything, trying to memorize for a number of days. And now I went to do UWORLD questions on Renal, and I think my score was almost like a 0. I remembered nothing from the book. So that tells me that just taking this book to the library to read is not enough. Now, what you want to do is that now that there are a lot of resources, resources, right? Sorry, resources. My English is not very good, so please just bear with me. So now that there are a lot of resources, what you want to do so that you don't waste your time is that Now, if you want to do hematology from first aid, for example, it's two ways. For some of the topics, they are treated very well on boards and beyond. Some of the topics are treated very well in pathoma. With hematology, I will say don't start with the first aid, start with pathoma. Now, pathoma, although it is pathology, there's no way you cannot understand his pathology without knowing physio. So he teaches the pathology with physio at the same time. So first of all, you want to watch pathoma for hematology, for example, and you have your first aid by your side. Now open your pathoma video and then the pathoma book. And now after watching this, let's say if you watch this for a topic, if you watch, let's say he's talking about if he's talking about something like lead poison, and then he's talking about it here, first of all, watch it from this book, the pathoma book, and now look in the first aid and read from there. So that way you are able to combine the two and you are able to understand better. But reading the first aid alone is just like pouring water on stone. It's gonna just splash off and then dry over, and then you forget everything. So you want to do them strategically. And so like mostly with a physio, if you're struggling with physio, you want to go into you want to approach it by doing boards and beyond, B&B. So usually boards and beyond, what he does is that most of his videos, he goes according to the first aid. So treat this book as a reference book, but the lectures are from boards and beyond. The lectures are also from pathoma. Now, if what I'm saying does not resonate well, the simplification of that is that now every topic has physio and pathology as the main things that we are looking for. So learn the physio from boards and beyond for a topic, and learn the pathology for the same topic from pathoma, and you should be fine. Don't take any of these books on by themselves and just start reading when you haven't watched a video that guides you as to what to learn. Yeah, and after watching a video for a particular topic, let's say him, if you're doing him, you are dedicating maybe a week for him. At the end of the week, you should be able to do your NBME, your UWORLD questions on him and see how you perform. So my personal testimony is that my him was very, very bad. My hematology was that bad. So hematology, I remember, is like the first, the 4 to 6 chapter in pathoma. Yeah, 4 to 6 chapters in pathoma. So what I did was I will watch his videos, and when I watch his videos, I underline a lot of things and then like take note of them, and then after that I will do UWorld questions on those same topics. And my scores, I was getting like 80, 90. It's just like you just finished and like you are doing the questions, so you are going to score very high, versus just doing the book alone. Like that is not worth it. So don't read the first aid alone. Use it with Boss and Beyond. Open him in the book, and then just treat the book like Boss and Beyond is helping you read the book. That's how it is. Yeah. So I hope that answers your question. And if you are just joining us, you are welcome to ask any questions that you have concerning the USMLE, step 1 and step 2. I did mine step 2 recently, and that was last week, and waiting for my results whilst I'm doing my application at the same time for 2023 residency March. So hopefully soon I can say, hey, I can tell you guys that I'm a resident, and then yeah, I'll feel so proud now, Yeah, I hope so. So next question from Melissa. She is asking, can you make a future video about study strategy for step 2? Of course, I will do exactly that. Like, yeah, after the dust has settled on the trauma that we went through in step 2, like, yeah, I will do some video definitely on that. There are a lot of things that people should know. Some of the topics, like, they're just in the book naked, and then we have to put clothing around it in order to be able to memorize. So all those like quick tricks that I use to memorize stuff. Like I'll put them out there. I made my personal mnemonics as well, and you all will have access to them. But first of all, kindly share this video and also subscribe and invite your friends to come and watch with us. So if you are just joining us, you can ask all your questions about USMLE Step 1 and Step 2. Okay, let me see. So Mama D, did Amber Step 2 self-assessment? So okay, did Amber self-assessment, studying prep, got 200. Where can I land after studying for it? What do you mean by where can you land after studying for it? Because you started your studies and then you did Amber's self-assessment 1. I think that was the free one. I got 227 on that at the beginning of my studies, and I think 5 months down the line I was ready to take the steps. So that Amber's self-assessment, a lot of people don't count on it. If you are ready to take your exam, if you are really ready to take your exam, you should be scoring very high on that Amber's SA1, the free essay. But even when I was like 5 months down the line, my scores were not too much different from that, because I remember my last NBME 12 was like NBME 12, 225, which was even lower than that. But it doesn't mean that my knowledge is as it was when I took the Amber's SA. Yeah. So yes, okay, Mama D. So you said I did it before starting my prep. Yes. So of course, I took it as a baseline. Yeah, of course, that is a good baseline. So with the Amber's, it has a lot of topics that you can like just remember and then approach them well when you start your actual studies and dedicated. But yes, of course, it's a good baseline. It means that you're not starting from the scratch. You're not starting, like, you have some knowledge, just that the way the questions were asked, and maybe you were just not ready for those kind of questions. So yeah, it's a good start. I'll say it's a very good start, and just keep pushing, and you will be fine. Yeah, just keep pushing. Do UWORLD, do Amber's, use the first 8 step 1, your mnemonics, just keep them, and then you should be fine. I don't know if that answers your question. Yeah, but of course, you said that's your baseline, so yeah, you need to do more studies. Just keep pushing, you'll be fine. Let's see, from Mama D, like, where are we going next? Okay, so congratulations, thank you from Super Foderi. Thank you. Did you find the real exam more like NBME, CMS, or UWorld? Okay, so this is what I would say. CMS is out. Like, there was nothing close to CMS. It wasn't close to CMS for me. The question, like the number of lines, the length of the questions was just like UWorld. Some of them were 4 lines, some were 5 lines, some were, like, I'll say 20 lines. Okay. So, but then you see, those ones I'm saying, they are 20 lines, they are like the patient chart where they write, just like if you've done OET, the way it is written on the OET sheet, that is how it is. So patient information, like a folder, and then like demographics, and they put like presenting complaint, history of presenting complaint. Then they do assessment, cardiovascular system, maybe pulmonary system. They put all that down there, and then they ask 1 or 2 questions about the patient. They ask maybe what kind of drug, but usually those questions are very easy. Like those that are very long, they are very easy. If you don't have time, just choose A and move on, because usually when the questions are long, they put the answer first for you. They put the answer on A. But I'm not just saying it's a bad test taking strategy, but some of the questions were really long, and I would say, like, you should prep your mind to see very long questions, and do not waste time. Don't waste time on any question, because going forward, they bring the shorter questions first. So if you waste time on the shorter questions, you're not going to get time for the longer questions. Yeah, so don't waste time on any question. Yeah, so I would say the questions were more like UWorld for me. They were more like UWorld. more like UWORLD, not even up to like NBME. They were more like UWORLD for me. Yeah. Okay, let's see the next question. Sir, what's the possibility of an IMG to match into neurosurgery residency? Oh my God. I think it's going to be very difficult. But if that IMG is coming from Caribbean, it might be possible. But neurosurgery, it might be difficult. But of course, and there'll surely be people who have merged into that. But you can connect to people on LinkedIn and then ask more questions if you can meet some program directors, because sometimes they consider the school that we went to. If there's nobody from your school who is applying, or somebody who has ever done that program and did well from your school, then your chances are slim. That's what I was told by one doctor who told me, like, she sits on some of the boards. So she told me a lot of information about that. And then let me see. There's another question here. And quality and safety was heavily tested on step 2 CK. Yes, quality and safety was heavily tested. Quality and safety, ethics, and and patient safety, they are all heavily tested. You want to read them very well, do ambos questions on them, and it should be fine. I'll say they form about 5% of the exam. Yeah, because every block had about 5 to 6. If you combine ethics, quality, safety, and quality improvement, almost about 10 questions for every block. Yeah. Okay, now another question, sir. Hey, let me see. If someone passes step 1, are they allowed to practice in the US before writing step 2? No. You cannot practice with step 1. Even step 2, you cannot practice even with step 2. You are only doing residency under observation. So this doctor told me that when you do step 3, then when you are on duty, your supervisor can sleep, is allowed to sleep when you are there. But when you do step 2 alone and you are in residency, then your supervisor is not comfortable. They cannot sleep. But so step 3 is like you are a doctor, you are a full practitioner, but you just don't have your full license yet. But for step 2 alone, you are still considered as a student. So yeah, that is it. So you cannot practice with step 1 anywhere. Nope, there's no opportunity for you. You might be able to get some jobs like being a physician assistant and all that, but not working as a doctor and prescribing med for patients. Any advice? Melissa says, any advice for shelf exams, especially for internal medicine? Yeah, I would say do them. Do the shelf exams. Very important. I did 3 for each of the subjects. I did 3 shelf exams. OB is very important. But even though I did them, I wouldn't say I saw questions directly from the shelves. Maybe they prepped my mind and I didn't know, but I didn't really see anything directly. If I want to do all this again, I wouldn't do shelf. I'll do NBME and do I'll do the NBMEs and do UWORLD. I think that should be enough. And do ambos. So do ambos ethics questions, the 160 questions, and then and after doing ambos, you do all the NBME questions and then do UWORLD. It should be enough. The shelves were not really represented on the exams for me. Okay, here so you will sit for the exam in 2 months, but I forgot a lot and my NBMEs are so low. What should I do? Yeah, so if it's 2 months, you have a lot of things, you have a lot of time. I felt the same. I felt like I knew nothing. Like I wake up and I don't know it. I don't remember anything. But the way the brain works, when you see the questions, you will know what you know. But if you don't have questions in front of you, you might think you don't know anything. Sometimes we genuinely forget stuff. So what I did when I started forgetting stuff was I downloaded the Anki flashcard app onto my cell phone, and any UWorld question I did, I will take a picture of the like, let's say I do a UWorld question and I miss it. If I miss a question, and so I'm going to ask that question in a simple form. So I'm not going to ask the whole question, just ask one or two sentences in the question and say, okay, what is this? Or what's the name of this? Or what is similar to this? What's the difference between this and that? But the answer to that question in the flashcard or the back of the flashcard is going to be the UL table, the table that you will use in its explanation. I'll use that in that particular question so that when I'm doing a flashcard, I'm doing flashcard for only UWorld tables. Now, if there's any explanation in UWorld that is of interest, then I'll make sure that I capture the whole screen to include that explanation, but I'll highlight them with a yellow ink or something, and then so that when I'm doing the flashcard, I'll pay more attention to that. So that is something that helps with space repetition. Forgetfulness in the exam, in our studies, is normal. You might forget stuff that you will never remember again. There are some also you just forgot because nobody's asking you. So if you are forgetting because you didn't study them well or because you don't know it very well, then you want to do the flashcard for space repetition. But if you are forgetting because you know it and then no one is asking you, that is why it's not coming to your mind, then you are okay, you are fine. So do flashcards, and then make sure you do the flashcards every day. Make sure you make time for the flashcards. If you are 2 months into your exam, you would have done a lot. You would have done a lot already. So you just want to do space repetition of the same things, and then you should be fine. Let's see the next question. It says, Mama D, I did it before starting prep for step 2. Okay, makes sense. And okay, let's go. When did you know you were ready to sit for the exams? All right. So I knew I was ready when I got 241 on I think NBME 11. That's when I knew I was ready. But then I still knew there were like some finishing touches that I had to do. So first of all, 3 weeks back, I did UWorld Essay 1, and then I got two what? I think 216. Like it was maybe 219 on NBME, yeah, something like that. 219 on NBME, sorry, on UWorld Essay 1. And then I did NBME 9 a week after, and I got 216. I dropped. So that was a wake-up call. And now that wake-up call told me that going into the exam, don't just go with your raw mindset, like that step 1 mindset. What you have to do is try to read meaning into every question. Look at this. Let me put this question. I hope I'll say the question, and then I just want to listen to your answers. Okay, so there was a patient who presented with let me say essential tremors, right? And this patient was treated. He was given medication. Now the next morning he came with severe abdominal pain, okay, and maybe having diarrhea and all that. So now what will be your diagnosis of this patient? So before I started doing well, I wasn't really reading meaning into questions, like the associations. So with this, let me see if someone is answering the question. Let me see. Yeah, I don't know if someone's answering the question. Like a patient presented with essential tremors that was treated, and now the patient is coming with severe abdominal pain, and they're having confusion, and then they're having neuropathy in their hands and fingers. Like, what would be the answer to the question? Again, I can ask again. Patient presented with essential tremors, right? And now the patient was treated. The next day, this patient came with severe abdominal pain, neuropathy or tingling in the hands, and then they are a little bit maybe confused or something, like what would you think the diagnosis is? So when I started thinking about putting things together exactly, so someone has given me the answer and I'm so grateful for that. So that is, the patient was given primidone, and then primidone is a treatment for essential tremors. Now this primidone is the one that triggered the acute intermittent porphyria, right? Yeah, so acute intermittent porphyria. So this is how it was. But when I was doing my UWORLD SA1 NBME 9, I wasn't reading any meaning into the question. So yes, if you can really reason and know the head, the questions are going after association, so that if you see a question that is going after association, you should be able to detect it, and don't just answer the question raw, like with no reading meaning into the question or no understanding of the question. Now, after getting primidone, you don't stop at primidone. Now you go into your first aid and see all the drugs that can trigger the AIP, right? All the drugs that can trigger the acute intermittent porphyria. Now, you don't also stop there when you know all the drugs, like all the cytochrome P450 inducers. Like, you don't stop there. What you have to do is that continue to ask yourself, now, what enzyme is deficient in this patient? Right, so that is very important. Now, you don't also stop there. Now, how do we also treat this patient? So if you can ask yourself these questions, that means that you are able to predict what the exams can ask. So just with me like talking about this like this, it exhausts that topic. It exhausts it. So in the exam, they can only ask you maybe the triggers, the presentation, which will be the diagnosis, and also how you treat it. So broaden your scope by answering questions in this way. Don't just do what is in UWORLD. Don't just like read exactly what UWORLD tells you. Read meaning into what they're asking you, and make sure that you extract more information from the book to add to that, and ask yourself, what if it is asked this way? How would I approach it? If you would ask about causes, you need to ask yourself about the treatment. If you is asking about treatment, you need to ask yourself another question and find a way to memorize it. Very, very important. So this is the strategy for me going forward. Now, if you do this consistently for every question for UWorld, you don't have to do amboss. But because UWorld asks the causes and amboss will ask the symptoms of the same topic, so it's kind of like that. Amboss goes through UWorld questions. I think they have an idea about UWorld questions, and then they ask the other version of the same questions. So yes, if you're someone who does not like scrutinize the questions very well, then you are likely to benefit from amboss. But if you scrutinize the questions very well, then you don't need amboss. Yeah, like that. I hope this answers somebody's questions. Was it the optimum team to complete UWorld for step 2? You don't have to necessarily complete UWorld for step 2. Not necessarily. I know a lot of people who did not complete it and they did well. You don't have to complete it. People did well, especially those who just began step 2 right after step 1. You don't have to complete it. Like if you do about 60, 70, 80%, you should be fine. But if you're like some of us, like I took like 6 months break, and yeah, and I forgot a lot of things from step 1 before starting step 2. So I used 6 months to study for it. So yes, so you don't have to necessarily complete it. So if you are just joining us, kindly let us know your questions that you have for step 2, and I will answer all of them. Also, you can share this with your friends, share it on your WhatsApp status, let your friends join us, and also make sure you subscribe, because we'll be doing more interesting videos. I want us to build a community here where we can support each other, not just for studies, but even in residency. We are going to keep in touch and still be talking with each other and sharing ideas, and going forward, that should be helpful to us. Let me see, next question. I'll come to everybody's question, okay? So Yes, so this is how I answered that, how I got to know when I did very bad, and then I changed my way of thinking within 2 weeks, and I jumped from 216 to 41. That's how I knew that I was ready. So from there, from that time, I read meaning to every question. Next question is, at what point did you decide to put a date for the step 1 exams? So it was like this for me. I registered for the oh, you mean step 1 exam? Oh my God, step 1 was like kind of frustrating. For me, my story was unique because of the COVID, I wasn't ready, and then NBME itself gave us some extension for 1 year. So, and because I was working as well as a COVID frontliner, I couldn't meet my personal deadline to take the exam. So that 1 year was helpful. So I had to extend my exam again for about 1 year. So that is it. It wasn't like I wasn't the same for others. My situation was kind of different. But for step 2, I had registered, I got a triad, but I didn't choose a date until I was like 1 month or 2 months away from the exams, and I chose a date. Yeah, I wouldn't rush into choosing dates. All you need is to study. That's what is important. Okay. Let's see the next question. So someone said, I graduated in 2005. How can I build good foundation for step 1? Okay, so yeah, it's possible. Of course, like 205 is a very long time, but hey, I wouldn't say don't give up. You can start it. A good foundation. Start your studies straight away from boards and beyond, in combination with the first aid, and do pathoma, also videos, boards and beyond videos, combine it with first aid. So when you are doing boards and beyond, open the boards and beyond videos and open your first aid for that topic, and treat it as if he's helping you to read the book, so that when he's talking, you are pausing the video and you are making references to the book, and you're underlining things that he's talking about, and you are making annotations in the book, and that is it. And a lot of us, we have problems because there's this thing that worked for me in step 1: definition of buzzwords. Not just the buzzword, you have to understand the meaning of the buzzword, like how is it defined, because they are moving away from the style where they will just ask you about the buzzword, but now they are defining the buzzword. So you have to understand the definition of the buzzword, and that would really help you. So if you start your studies, just make sure that you inculcate or you include buzzwords in your studies, but make sure that you understand those buzzwords, very important, and also appreciate histology and mnemonics as soon as possible. And then you can do it 205, you can do it, just all you have to do is start with boards and beyond and start doing questions from UWORLD immediately, and then you should be fine. I believe 205, if you are practicing, your knowledge might even be higher than some people from some medical schools, but we've still been able to take it. So yes, you might have a lot of knowledge. The only thing is that maybe the classroom physiology and the physio and some biochemistry that you might not be that you might have forgotten. But biochemistry it's also one of the difficult topics, but I suggest to people who are now starting their studies to watch Dr. Najib ASAP. Go to Dr. Najib and watch his biochemistry videos ASAP. Like, I got my study partner to do that, and then her biochemistry improved like immediately. He paints a mental picture for you, so take your time. If he's talking too slow, you can increase the speed a little bit, and then watch Dr. Najib, and then with the first aid, you should be fine. You will be fine. Let's see. I hope that answers your question. Let me know. Someone says, Asan Amar It says, just joined a while back. Can you list the basic resources to achieve a high step to CK score? There are so many resources, like resources out there, a lot of resources out there, but I only used two main resources. I used UWorld. UWorld, very important. I did one pass of UWorld where I did shelf review. It was more step 2 shelf review for the first pass. Then the second pass of UWorld, I did let me see, I did 43% of the second pass, but this time it was mixed. So UWorld is enough, plus the first aid for step 1 is enough for those of you who are who have done first aid already. Those who have done step 1 already, your first aid is still your friend, plus UWorld is enough for step 2. Now, if you are someone who is writing your step 2 before step 1, then you surely have to go with the book. You surely have to go with the step 2 book. And some people also use online med ed. It has worked for some people, but I didn't use it. I didn't have to use it. I didn't use this book also. I didn't use the step 2, but I watched someone from YouTube who said, he opened his book and he had annotated in every page. So if you watch my book, it's only few pages that I use, about 10 pages out of the whole book for some kind of reference, but not really. I didn't really use it. Versus if I show you my step 1 book, you will see that every page has been used. Every page for step 1 has been used. You see? Yeah. So I use step 1, this book, for my step 1 and step 2 plus UWorld. Very important. But as for step 1, I added Pathoma to it. Yeah. This is a very good book. The Pathoma is a very, very good book. Yeah, let's see the next question. So he says, how many months can I finish step 1 and step 2? To be objective, you might need close to 2 years. You might, if you've not been studying for a very long time. Like if you are now studying everything, to be objective. I remember someone told me I might need about 2 years, and I didn't believe it. I asked the person, like, are you serious? Like, do you know, like, maybe you used 2 years, so that's what worked for you. Maybe I can use less, but hey, I'm almost in my let me say 2.5 years since I started step 1, and it's that hard. Like it's time involving, because we'll make a lot of mistakes, but like, if you're not going to make mistakes, you should be fine. But everybody makes mistakes and they correct it as they go on. If you can appreciate flashcards early in your studies, you will save a lot of time. If you can start using mnemonics early in your studies, you will save a lot of time. If you can learn the buzzwords very early in your studies and learn the definitions, you should be good. So it depends on your approach. Some people will need even 3-4 years. And my very first study partner, she's been studying for, I'll say more than like maybe like 7 years, and she has still not written step 1 up to now. Like, I'm not trying to talk against her, but that is the fact. Like, because other things show up in life, like especially women, when you get married, like people start asking you, when are you going to have a child, and all that. So yeah, it's a lot going on. People are faced with a lot of things in their life. So yes, I would not say that there's a definite time to write for the exam. Example, if you are studying and you are a female and then you get pregnant, some continue, but if you get pregnant and the pregnancy is making you sick, there's no way you can study, right? Like, it becomes hard. So life events can change the duration, but to be realistic, 2 years. Let's say you are studying step 1 for 1.5 years, or for 1 year, and then you're using 6 months for step 2. Like, that is still within that 2 years frame. So you should consider that. I hope that answers your question. I'm not trying to discourage you. When we all started, we didn't know it was going to take this long, and we never got discouraged by okay, whether it to take 2, 3, 4 years, but you want to think about why you want to start it. no matter how long it takes, you just want to become a doctor in the US and work in the state of the art facilities and maybe one of the highest paid doctor salaries from the US. So yeah, you have to understand why you want to do it. You want to change the life of your generations. You don't want your children to you want your children to have a very good lifestyle. You want them to go to the best schools. So you have a reason for doing that. So yes, I would say consider why you are doing it versus how long it's gonna take. Just focus on it. Know that you can do it. Some people use 6 years, some people use 5 years, some of us we use. I'm in my third year when I started, but yes, I'm doing it. Yeah. Let's see, next question. Okay, I talked about the resources already. How many rounds of UWORLD have you done? If you're talking about step 2, then I did my first round of UWORLD. I think it took me about 3 to 4 months to finish. I did them as a step 2 review. It was more of step 2 review for me. Let me see. Create. What did I do? Yeah, it was more of I did the step 2 review. So yeah, it wasn't the shelves. Let me see which one I did first. Yeah, I did the shelves first. Sorry, I did the shelves first, like from UWorld. So you can set. Let me show you guys. So this is it. With the UWorld, we have the shelf. This, and then we have step 2 review, and then we have the shelf. So with my first pass, this shelf, whereby I'll finish all these. I'll finish ambulatory medicine, all the questions, and then do neuro next and do emergency medicine next, like that. So I do them subject wise. But when I came to my second pass, then I came to this side here, which says step 2 review, and then I'll do mixed questions, and that was kind of helpful. Yeah. But it all depends on you. Let's see, next question. I hope I'm answering your questions. Do you recommend using Boss and Beyond for step 2 CK? No. The only time you want to do Boss and Beyond for step 2 CK is if you have forgotten something. But everything is in UWorld. Do not waste your time. If you've done step 1 already, do not waste your time. If you have forgotten something, then you can go there and do it. There are some people who want to do something like maybe microbiology. Not necessarily, like, you don't really have to do it. You don't have to do it, but you can watch them real quick with speed. But everything is in this book. This book has everything. They have everything in it. And so you don't want to waste your time going to do that Boss and Beyond and all that. It's not necessary. You better create flashcards and read those flashcards several times. That's better than going to the Boss and Beyond. I have no financial disclosure, so so I'm just talking raw from my own experience. That's my personal experience. You don't have to do it. Let's see, next question. USMLE Alatbi, thank you. You're welcome. Maxim Kadi, thank you. You're welcome. And next question from Robin Hood. What extra subjects are on step 2 compared to step 1, like surgery and pediatrics? Oh, you want to know those subjects? Yeah, so we have psych. So these are the main subjects. There are 5. They are medicine. We have OB and gynae, and pediatrics, psych, and surgery. So there are 5. There are 5 in all. But then they are subdivided. Like if you take medicine, we have emergency medicine, we have medicine itself, and then we have ambulatory medicine. So it's kind of like that. So it's just 5 subjects. And I hope that answers your question. And let's see. But then this is just about in the medicine, there are other things like biostatistics is part of medicine, ethics is part of medicine. So like that, you should understand that. So if you just joined us, we are talking about USMLE Step 1, Step 2. I did my Step 1, Step 2, my Step 2 recently. That was last Tuesday. So I'm just answering questions. I have, like a lot of people ask questions, so I'm just giving opportunity for them to ask live and then I'll answer them. Hello everyone. Do you need a license from your country to write USMLE and march into residency? Yeah, so this question is a very good question, whether you need a license in order to qualify to write the USMLE. So the answer is no, but a license from your country is very good, but it doesn't guarantee you a place in residency. Now, in order to qualify to write the USMLE, the basic thing they need is that you should have completed your even you don't have to have completed, like you should be enrolled in a medical school, and also your school should be accredited or recognized by the World Directory of Medical Schools. So go to the World Directory of Medical Schools and find your school. If your school is in it and you are in a medical school, you can register and write. Now, if you have completed your school already, yes, you can still register and write. And if you are working in your country and you have a license, you can still register and write, but you do not have to have a license before you qualify. Now, having a license, the only thing it does is that one, it can delay your step 1 and step 2 prep, because having a license means that you are most likely going to be working in your country. 2, having a license can give you a good case when you are applying for residency. For example, if you are if you are having a surgery license in your country and you apply for a surgery program here, they will choose you versus me that has never done surgery before, right? So it's more like that. They'll choose someone. If I get the same score with someone and then he is in his country already practicing for 5 years, they're likely to choose him versus me. Like, of course, if I'm a program director, I'll do the same. I'll choose an experienced person versus an inexperienced person, because patient safety is very important. Let's see. Next question is, are there universities or institutions which can, or are there universities or institutions which can prep you for USMLE? Yep, there are not universities unless you enroll back into a university for that, but there are review programs like the PASS program. There are programs like the Kaplan program where you have to join them online. I think the PASS program was like $5,000 for like 6 months or so, which is very expensive. And from experience, like not from my personal experience, but experience from a person like my study partner, she went for the Kaplan PASS program, and she did not, she told me that it was not worth it, because they come to the classroom in the morning and then they lecture you guys like 2 hours and they leave you to do your own reading for the rest of the day. It's just like staying at home and watching Boss and Beyond. So for me, Boss and Beyond is a whole institution on itself. It's better than going to pay money. What you benefit from paying money to be in those review programs is that discipline, because you are there to study, so there's discipline. But if you can stay home or be going to library every day and then just watch Boss and Beyond videos and watch your Boss and the Pathoma videos as well, and keep doing your UWORLD and get a study partner who can complement your knowledge and also complement your efforts, like in the sense that when you feel down and you don't feel like studying and your study partner is in the mood, then they drag you along. When she also feels down, you also drag them along. So that helps with that consistency in studies. So I wouldn't advise you to waste so much money. Already this process is capital intensive. The whole process itself, when you start your step 2, you even spend more than on step 1. So yes, you don't have to do that. You don't have to necessarily go for review programs. Now, someone says, do you recommend using Divine Intervention podcast? So with these podcasts, like we have Divine Intervention podcast, we also have this one in my holiday podcast. I listen to both of them. I listen to Divine, but not everything. I listen to them selectively when it comes to, like, at the beginning of my studies, when I was trying to like still like put things in my mind, like remember stuff. I remember when I started doing the shelf, my first pass of UWORLD, the shelf review, it wasn't like I wasn't remembering certain things, right? So I watch Divine Intervention, and then when he says something, sometimes I'll see them on UWorld. But yeah, I wouldn't say they are not good. There are some people who love to listen, and then the thing sticks in their mind. I also remember when I did some NBMEs, and then when I did the shelves from the CMS forms, and then I listened to Divine before doing them. Like, there were questions that he talked about. Like, if I did not listen to him, I would have missed those questions. So yes, Divine was helpful. In my holiday was excellent also at the beginning of my studies, and Dr. High Yield was also good at the beginning of my studies. Yeah, but going forward, like, you'll get to this point where your knowledge becomes so much more than what they are talking about in their videos, so you might not need them towards the end of your videos. But then some people say that, like, videos on the military, like getting close to your exams, and videos on the military, videos on risk factors, which I didn't find helpful, because his risk factor video, for example, like, is limited to what he's saying versus when I was studying, like, every UWorld table that had a risk factor, I take it serious. So I knew a lot of risk factors versus what Divine was saying in his video. So Divine videos are good for those who love to listen, those who are good listeners. For me, like, if I listen to something today, you ask me tomorrow, I'm likely to forget, like that. So yes, you can watch Divine, especially at the beginning of your studies, and he stimulates your brain a lot. Yeah. Yeah, somebody's also let me also address this part of the Divine thing. I also know someone who, like, enrolled in the rapid review course, and then the person also said, like, it was more like compacted information. They compact the information for you over 20 hours, and our brain is such a way that, like, it gets to some point, and then, like, whatever you hear, you can't process it. So you do those things strategically, like, just know the right time to do it if you want to enroll. But if you are doing his rapid review program for at the beginning of your studies, then I think it's not a very smart thing, because he's gonna pour a lot of information on you when you don't really even understand those information. So if you want to do something like that, it should be maybe towards, like, the middle of your studies period going forward. Yeah, I hope that information helps. Let's see, next question. Thank you for the insight. You're welcome. Do you recommend using Divine? Okay. Did you watch Dirty Medicine video? So with Dirty Medicine, I did only one of his videos. It was on renal tubular acidosis, where he made a mnemonic, I think 214 PDC low more. That mnemonic for renal tubular acidosis, very, very helpful. That's the only thing I watched from Dirty Medicine. But a lot of people say he's so good, and I think so too. I think he's really good. He has a lot of videos. So if you're struggling with some topics, you can watch him as well. I mean, it all depends on if you like the teacher or not. Yeah. Water is empty. Can I just grab some water real quick? Okay, just a minute. Sorry guys, I'm back. Okay. Okay, now let's continue. So if you are just joining us, you can drop your questions about step 1, step 2, any question that is bothering you. I'm ready to answer them. Okay, so you also ask about YouTube channel and Dr. Randy Neal. He did more of biostatistics. Yes, I did him for step 1. Step 1, Dr. Randy Neal was very helpful. Oh my God. I had no knowledge about biostats. I didn't do that in my university medical school. but I watched Dr. Neil, and like he made things so simple for me. So yes, if you're doing step one, very helpful. Those doing step two also, it might, yeah, it should be helpful as well, because it's the same concept. But I think I became better in biostats, so UWORLD was enough for me. Yeah, and they didn't really ask a lot of questions. It was minor calculations on my exam. So yeah, you don't have to struggle so much when you're going to step two. But for step one, there was a very difficult question that you really need to like think, like you need to calculate one thing before you can use that to calculate the next thing. So it was more like harder for me on step one, even though I was able to calculate that question. But yeah, Randy is good. Now next is thank you so much for the overview of the study materials for step one. You're welcome. I greatly appreciate it. Okay, let's see. Thanks so much. You're welcome. Please, how much you charge for coaching per hour? Oh my God. This question, like, a lot of people want me to coach them. I don't know, I've not really come to terms with that, even though I want to help. But I have not had like that. There's a lot going on, that I haven't had like enough time to regroup. Like during step two prep, like there were a lot of things that I just let go, and I'm trying to get everything back. Like, for example, like usually on Sundays, I don't go to church. Like for the whole year, I didn't go to church because I'm always sitting here. I'm always here. And then I wouldn't have fun with friends. So now I'm trying to get all those things back. All the people I wasn't talking to, I'm trying to talk to them back. And I'm trying to have that social life again. Yeah, I'm trying to have that social life once more. But yes, that shouldn't prevent me from coaching people. But my application is also taking some time now, so I'm trying to like just get a lot done, and then I'll come back and then coach people, and then I can decide, okay, how much I want to take. It's also depend on the number of people who will join my class. So if I get more people, then I can make the price very less, because if I decide to go and do if I pick up a nursing job right now, like I get offers every day, like $4,000 per week, and I've not taken them yet. If I decide to go and take that versus if I want to sit home and coach people, I have to make sure that there's a balance between if I were working versus if I'm home coaching people. I should be able to balance that. So yes, I have to decide and come back to you, please. I want to be fair to everybody, and be fair to myself too. Okay, so let's see. Can I use first aid for 2019 or 2020 if I plan to write a step in 2023? No, 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 no. Gracious, please, no. No, they'll be too outdated. There's a lot more information that are being added to the books. And I'm still showing you this because I had written mine in 2021. I wrote my step one in 2021, but what I was doing was that I had the online version of the most recent when I was taking it, so I could refer to that, and I didn't want to lose any of the annotations. I'm not going to do a new annotation in the new book. That's why I'm still holding onto this book. Yeah. So if you are taking it in 2023, you better get the new books, at least the 2022, 2021 books, because there'll be more information that if you're not careful, you might be missing if you're using the old ones. If you're using the old book, you don't want that. Even though you can still use them and pass, you'll get your score, but you want most recent information. Let's see. Can you work or do observations in the hospital whilst in the process of writing a USMLE? Yes, of course, you can do that. You can. It depends on the hospital. Like, I mean, you are studying and then you are just taking a free time, let's say like 1 week or maybe twice in a week to do observership. So you can do that. Some even allow you to come there maybe once in a week. It doesn't matter. It depends on your agreement with the hospital. So you have no problem with that. Testimony, since you might not have time immediately for coaching, what will be a standard schedule you will recommend for anyone when studying for USMLE Step 1, say, for example, 3 months or 6 months? So usually this question depends on your knowledge base. If you are someone, for example, someone said they've been out of school since 2005, that means most likely they are going to start from the scratch, and they are going to start everything. So I'll say if such a person, I'll say they should give about 8 months to 1 year, 8 months to 1 year. But if they can do most of the recommendations I'm talking about, get a study partner, mostly someone who has an idea about how to study for step, like already, not someone who also doesn't know how to study for step. Now, two, if you get your study partner, you want to stay consistent and be able to separate a lot of like social life away from your studies, like a lot of things that will steal your time from you. You want to be able to avoid them. And also you should be able to inculcate some of your I talk about buzzwords, like appreciate buzzwords early in your studies, and be able to combine these two books instead of doing them separately. You can combine both of them. Watch the physio part from BNB and watch the pathology part from Pathoma, and compare that pathology to the pathology in the first aid, and make flashcards and keep seeing them every day. If you start that early in your studies, flashcards early in your studies period is going to be very short, very, very short. Yeah. So let's see. I hope that answers your question. There's no specific time. It all depends on you and your efforts. Yeah. I hope that answers your question. It said, I have been out of school for over 10 years, but I have been studying off and on. That off and on is what we want to avoid. Off and on doesn't help, because you start studying and you come back to the same thing again, and stop and come back to the same thing again. It doesn't show progress. So you want to be really consistent. You want to choose what, I don't know, everybody and their situation. So if I say something, I'm going to be biased. But if you can choose, like, look at the picture of what you want to become versus what is holding you back. Those things that are holding you back are telling you that, okay, be consistent, be content with what you have now. But also, you also want to look at what you want to become. A lot of people have kids, like school after 10 years. I know by now you have kids, and sorry. It's hard to balance a lot of things. Very, very hard to balance a lot of things. But hey, if, let's say, for example, if I want to write USMLE step, to be realistic, if I want to write USMLE step and I have kids, I'll try as much as possible not to add another kid. At least I'll struggle with those I have already, but I'll do family planning so that I don't add another kid, something like that. That's more realistic than, I know someone who was studying, and then the first pregnancy came and they couldn't. I know. The first pregnancy came and then they gave a break, and they said, okay, let this child grow a little bit and I'll continue. Then the child grew to about 8 months to 1 year. Then another pregnancy came again, and then she had started studying again, so she gave another break. And then when this child also grew up, now pregnancy came again. So 3 kids, and I think the oldest is about 9 years now. So that person has also been out of school for 10 years, right? So now, if you have those 3 kids, and COVID also came, so now you have to take care of all those kids. And now some of the schools are saying, you either wear mask, and then some parents don't want their kids to wear mask, and some kids cannot wear the mask. So you have to train all the kids at home by yourself. Make sure they are home doing online class. So yes, sometimes we can make certain decisions that can help us. Like, let's try as much as possible. If if you really want to write the exam and then maybe your mom is somewhere and then she's really free, she can help you take care of your kids, your sisters can help you. It's just for a period. It's not like they are going to raise your kids for forever. It's just for that moment, our kids also have to, they also have to sacrifice, because it's their future that we are building, right? So they also have to sacrifice going to live with someone or allowing someone to come and stay with them at home and take care of them whilst mommy or daddy is able to study and all that. Yeah. And yeah, let's see the next question. How to crash step 2? You want to crash the step 2? Like, does someone have any solid metal that we can push? Let me see. You want to crash it, right? Are you ready? Are you ready to crash it? So maybe we need something like this to crash. Oh, boom, boom. Okay. So step 2, yes, step 2, how to crash step 2. So for me, my principle is CHF, okay? Is it chronic heart failure, consistency, hard work, okay? And what? What does the F stand for? Can someone tell me? yeah, you should be consistent, and then you should be hardworking, and you should be focused. Those 3 things are what works for me. You should be consistent. Consistency means that you are not going to break in your studies. You don't have to start today. When you are 3 months into studies, then you give up and then do something else. So that's consistency. You should be able to read every day, okay? Because you are not the only one doing it, and then you are going to write the exam with people who are consistent. So why don't you also become consistent? You're writing the exam with people who are persistent, so why are you also not persistent? And so consistency, hard work pays. That's what they say, hard work pays. I sit on this chair every day. In step 1, like, I had back pain, but for step 2, like, I didn't have back pain, because step 2 was not as hard as step 1. I would say step 1 has a lot of information, but step 2 wasn't like that. But I also added, like, changing my body mechanics. Sometimes I'll stand on this when I'm studying, and I'll just stand this way and be reading from my computer like that, versus always sitting. Yeah, so hard work really pays. Okay, let me not deviate. Hard work really pays. So paint that mental picture for yourself, what you want to become, and then the workload that needs to be in it. Join groups of people who are doing USMLE. Now, if you surround yourself with people, like 5 people, like, you are one third or 1/5 of those people. So if you join groups like Reddit, and then you are seeing posts from people who are like you, who are scoring low like yourself, and now they have improved, then you are likely to also study hard, and then just remain consistent and then study like them. But then if you don't join any group, and you're not talking with anybody who is writing USMLE, and you also don't have a study partner who pulls you along, then doing everything by yourself, you might just be in your own comfort zone and do whatever your mind tells you. So yes, you want to be consistent and persistent. Now, next is focus. Focus is very important. In our communities, like, there are a lot of things that take our attention away. Like, when I started studying for step 2, I would delete some of my social media apps. I'll leave WhatsApp, because I was doing research. My research group was on WhatsApp, so I will leave that. And also, I'll leave maybe Facebook and then Reddit. But all others, like Instagram, Snapchat, that would waste I've never subscribed to TikTok yet. TikTok, I've never subscribed to it, but you don't want to, like, it's just not compatible with USMLE, unless otherwise you have a group in there that is for USMLE step. But if not that, and you want to live your life like other people, like people who are just going around. I mean, day to day, their life. People are making money from it, but that is their way of life. Like people in the club taking pictures and post on social media, and then if you want to be using your time to learn and follow them and do whatever they are doing, then you are not growing in your field. They are growing in their field. They want to be at the club. They want to be dancing. They want to be drinking alcohol. So you don't want to waste your time following other people. And the more you watch them, the more they make money. You see? So let's also find a way to focus in our little corners and separate ourselves a little bit away from like the social world. And yeah, it's rewarding at the end. Like after writing my step, I felt like there was a big load that is taken away from me, and I don't know who hung that load, and I don't know how heavy it was, but I really felt like there was a big load that was lifted away from me. And I felt, for the first time, like I would say, I felt happy for the first time in a long time. I felt happy after writing step, even though my results are not in yet. So if you are just joining us, we are just talking about the steps. If you have questions, step 1, step 2, if you have questions, go ahead and drop them. Also, consider subscribing to our my channel. Now I have about 2,200 subscribers. So if you have friends who are also taking steps, you can share with them. Those who have interest, just share this video with them. Also like the video as well, and share with your friends. Subscribe also, and put your questions down there. I'm glad to answer them. So let's go back to how to crush the steps. So I told you CHF, consistency, hard work, and focus is very important. Because now, if you have all those things in your bag, then now you come back to the book and apply those things in the book. Never give up. There will be times that you feel like giving up. If you feel like crying, hey, lay in your couch and cry, because it gets to all of us at a point where you will study, and then at the end, like, you just feel like you're not improving, and you don't know whether you can do this or not. If you feel like crying, hey, come find me, we'll cry together. Okay, I'll help you, we'll cry together. Okay. So you will be fine. Everybody will be fine one day. Just don't give up. The only person who will not be fine is the one who will give up. If you stop studying indefinitely, that is it, you've given up. But if you don't give up and you keep pushing, you will surely arrive at a destination, no matter how long it takes. Yeah. Yes. There were times that, hey, even after my step, when I was remembering, like, how, like, when I remembering, like, my life situations, and then where I'm coming from, and finally I've written step, like, I was crying. I was really crying. I was just there. Like, after writing my personal statement, and I was reviewing it, and I remembered, like, life events and how far I've come. Oh my God, I started crying. I started crying here, and yeah, it was yeah, it's I don't know what word to use for that, but yeah, I felt so sorry for myself. I felt so sorry for myself. I started crying. Yeah. And at the same time, I felt happy as well. Yeah. So testimony, saying, I'm a single parent with 2 toddlers, and it's no joke, but have been at the library all day every. That's excellent. Going to the library is a very good thing. I was doing the same thing. I'll go sit at the library and come home when I like. And I start back to work in a week, but I intend to study every day after work and all weekend. Okay, so you work all weekend? Yeah, you work all weekend. So I have my mother helping, but your advice made things clearer for me in studying for step 1. Thank you. You are so much welcome. Yeah, I just want to help. I just want to help. A lot of us, we allow family pressure, like, go take the exam. You are writing your exam, and you are not doing well, then your mother is pushing you to go and take the exam. You will pass, like, as if she works in the as if she works in the NBME office, and then she's gonna pass you. It doesn't work that way. This exam is not about I know a lot of people talk about faith, but I also know someone who talk about faith and failed, yeah, you really have to know the information. That's the surest way. You know the information first, then you pray to God that when you write it, you don't fail or nobody changes your result for another person, kind of like that. But you really have to put in hard work, because even God wants the doctors who will be treating his children to be very good doctors already. So he's not going to produce fake doctors who don't know anything. So hard work is very important. So let's see the next thing. Says, so your mother, thanks to your mother for helping. That's a very good mom, who is helping. But just tell her not to force you to decide your date. You should decide it independent of anybody. She shouldn't give you any pressure to decide your date. It's not very good. How did you find a partner, a study partner? That's what you mean. I can't find anyone reliable. They always leave. Yes. Yeah, they always leave. So, okay, well, I also let someone before, so that's normal. So the principle is that if it's not working for you, you have to move on. Okay. So I first of all, I met this study partner the very first time. I met this study partner. She was a lady. For this lady, I love to feel free around people to discuss, even go beyond just studies, like discuss personal life and all that. But this lady, I don't know, she said her exam was so soon. So once we meet, she calls me on Skype. She's going straight to like the questions. Like, we don't even say hello, like how was your day and all that, and to calm down our nerves before even start studying. So she was the first person, like I couldn't continue with her, so I just stopped calling her, and then I told her, hey, I have to work. Yeah, but that time I was not deep into studies. And the second study partner was one lady. So I think she was more advanced when it comes to studies for step one. So we started, I think she gave me only 5 minutes. So she wants to read like from the first aid, right? And I wanted to read with her. But she was so good so that maybe she has read already and then she's just reviewing. So when we started reading, she could see that my reading even tells her that, like, I've not read the book before, so I'm just not compatible with her. She wants someone who has read it before. But I was reading. When I'm reading, I try to capture everything. Like, I try to memorize as I'm reading. There are some people that they finish reading and you ask them, what did you read? And they don't know what they read. But for me, when I finish reading, I will know what I read, because I read slowly and analyze each sentence when I move on. So like that, I try to memorize. But she was reading fast, and also she has done the book before. I've never done it. So she only told me, hey, my brother is calling me. I'll call you back. And I'm still waiting for her today to call back. She hasn't called still. So yeah. So it means that my reading wasn't good for her, and then my level of knowledge wasn't good. But that shouldn't discourage you. They will come, they will leave. You will find someone when you keep trying. Now, my third study partner, I finished this book with her. I finished this book with her. Like, we did the pathoma video. We finished the whole video. Like, but what we were doing is that when we watch every video, we are taking notes into another book. That means that we are transferring every information from this book into our notebook, which is not smart. So we finished that. My scores were not really improving. And then she was also a mother of 3, and her priority was her kids at the time. Her priority wasn't STEP. So, I wouldn't let that affect me too much. So I wanted to take my exam in the next 2 months, and you could see that she wasn't ready. So I was like, hey, I have to move on. I just told her, hey, my exam is this, so I have to, like, I was sincere to her, and then she agreed, and then I moved on. Then I found another study partner. I found a fourth one, which is the one I'm still studying with up till now. From step 1, we did all step 2 together. So with this one, she's more patient. She was the one who taught me how to study for USMLE, how to understand the buzzwords. Like, her pathology was just good. Like once we start reading the questions, she knows what they're going after because she knows the buzzwords. So she taught me that, okay, you must focus on this, this, and that. So now I went back to this book by myself and I was looking for buzzwords. So when I'm watching every video, I'm taking note of each buzzword. If I don't understand a buzzword, I'll Google quickly. When they say something like, I always use as an example, like when they say something like chipmunk, you know, like thalassemia, they have that chipmunk teeth, you know. Personally, at the time, I didn't know what a chipmunk was. I hope you guys can excuse me on that because, hey, I schooled in a very in a village where in a village, very typical village, and the education wasn't so quality at the time. I wouldn't say, but I mean, every country teaches according to its lifestyle. So that is what I had at the time. So I didn't know what a chipmunk was. So I had to Google what a chipmunk is. And once I saw the chipmunk, let me see. Maybe I'm not even saying the word well, but you're just pardon me. Let me see. If I put in Google here, chipmunk, is it chipmunk? Good, there it is. Good. Where's the teeth? Yeah, so if you see a chipmunk teeth or chipmunk faces, something like that, you see that the baby's face looks like a chipmunk, and that helps me to remember the buzzword. So that helps me to remember the buzzword. Here we go. So you all look at it. You see. So they describe thalassemia. Yeah, I'm from Ghana. Someone's asking, I'm from Ghana. You sound to me like a Nigerian, of course. Like even Ghana people think I sound like a Nigerian, but I'm from Ghana. And so if you see a child with beta thalassemia, or thalassemia, their teeth looks like a chipmunk. And so when you see chipmunk in your buzzword, you know that it is these animals that you see this child here. I even had this child in my flashcard. So I put this child in the flashcard and put the chipmunk in the flashcard and now add it to the buzzword, you know, and that helps me to remember the buzzword. So I did that for a lot of flashcards, like a lot of buzzwords as well. Like, for example, when you talk about the swan neck, like swan neck of, let me see, swan, I don't know how to spell it, swan neck. Let me see if I get it. Good. So now you'll see that this is rheumatoid arthritis, and then you all can see the swan neck. The finger looks like a swan neck. You can see it. Now let me just put swan alone, and then you will see that the swan, the neck of a swan, where is it? I don't know. Yeah, there's it. Okay, so I got a spelling wrong, you know? Yeah. Where is it? Good. So if you all can see the swan here, and then you see that its neck looks just like the swan neck they describe in rheumatoid arthritis. So that gives me a clear picture of the buzzword. So with this, I don't forget the buzzword anymore, you know. So if you can take your time and understand each buzzword, you will be fine. You will be fine over time. Okay, so please don't feel lazy investigating the buzzwords. Now, if you go to renal and they say tram track, right? Is it tram track appearance in the glomerulonephritis? Tram track, right? Now look, so I did that also, and see, if you see the image of glomerulonephritis, one of them, I think post rapid progressive, is like a tram track. You will see this, and so I add this tram track I add the tram track to my flashcard for that glomerulonephritis, and then you will see it here. And if you open it, it looks just like a tram track because you can see the tram track appearance all over in this image, right? You can see the tram track appearance. So I add this and this to my flashcard. So if you see this several times, it makes a very big difference in your studies, so that you don't have to come back to these flashcards again. So you have to do them until you graduate from the flashcards. But yeah, so that is, let's go to the next question. Please, can we get your Instagram Okay, so my Instagram is Jerry, Jeri, then underscore 788. Jerry, that's Jeri underscore 788. That's my Instagram. And then you can also check my YouTube channel page. It's right there. I put my Instagram link over there. Go to the About and then you'll see it. Now let's answer more questions. So this person said, how did you find a study partner? Let me answer that before we move on. So how I found a study partner was, there is this step 1 group on Facebook at the time. I don't know if it's still active right now, but so in that group, you just put in, hey, I need a study partner. I'm studying for step 1, and then I plan to take my exam around this time. Or, hey, I'm done with first pass UWORLD. I need a study partner for second pass UWORLD. And then somebody will show up. Now, you can do that across, like do that for Facebook, and then you do that for Reddit. Go to the Reddit step 1 or step 2 page and just put it there. Put it there. Like if you don't find someone today, put it there the next day, you will find somebody. Okay. Also, just as we are all interacting right now, somebody can just put in the comment group, we are a lot, right? So someone can just type in the comment, hey, someone need a study partner, then you all do your conversation inside the comment box, and then that also helps. I did that for my OET. I joined this online OET class, and then when the lecturer was talking, I just text one lady in the group and then said, hey, do you need a study partner? She said yes. Then we studied together. We spoke, like we did a speaking together, and then we both passed. All of us, like both of us, our English was not good, but we all passed. So study partners are very good. They're very good. Okay, now let's see the next question. I hope I answered that question. How to find a study partner? I did. Next one. Next one says, yeah, and also with a study partner, if they are not reliable, please don't risk your future. Don't be shy to move on when your future is at stake, because if you allow someone who is not serious to drag you down, you are going down and you will feel the pains in the future. So don't be shy or don't be reluctant to move on. If the person is not helping you, look for another person, because it's your future, not their future. Okay? And do you think better to focus on questions, like do 80 questions per day, better than reviewing first aid? Of course, questions are always better than first aid, but I would say when you are reviewing your questions, just have your first aid beside you, and don't feel lazy to open first aid to the page that the question is talking about and look for more information when you feel like UWORLD is not giving more information. Also, when you feel like UWORLD is talking about something that is conflicting or something you just remember but not very well, just go back to the book and read it, Yeah. Another thing I also did was, when I was getting ready for my step 2, in my final 2 months, when I was doing my flashcards, for example, like when I talked about the acute intermittent porphyria, I'll take a picture of the whole page of that, where that condition is, with the heme section. I'll take a picture of the whole page onto my flashcard, so that once I meet that flashcard, I'm reading the whole page of first aid in my flashcard. And when I come to a topic like glycogen storage diseases, when I ask myself, cherry red spot, it's in what? We know it's in what? It's in 3 things, right? So those 3 conditions, I know Niemann-Pick has it. I also know the Tay-Sachs has it, and the third one is the central retinal artery occlusion. But when I take a picture when I ask myself that, and I take a picture, I'll take a picture of the whole first aid page of that, the glycogen storage diseases, into my book, so that once I see that question, I'm reading the whole page of first aid. So I did that strategically for high yield concepts, Like, yeah, I did that for high yield concepts. Like when I come to neuro, Alzheimer's, prion disease, and all that, I make sure I have all the whole page in my flashcards, so that I don't have to read the whole first aid for step 2. I just do some high yield topics and make sure I master everything on that page. Next question says, please can we get your Instagram? I put that out there already. Jerry, JERI underscore 788. Are you a Ghanaian? Yes, I'm from Ghana. You sound like a Nigerian. Yes. It's because I sound like a Nigerian. I think it's because I'm multilingual and I've interacted with a lot of people. I'm someone who is multicultural. I lived in China. My med school was in China, and that was 6 years. So I have a little bit of Chinese in my accent. Like, I speak Chinese well. And in my classroom also, there were Nigerians in my class. There were people from Pakistan. There were people from Nepal. There were people from like multiple African countries. So we're about 200 in my class. So it's more like you're interacting with a lot of people. So by the time I came back from China to Ghana, like people were like, are you a Nigerian? And then my haircut also, I started like, I changed the style of my haircut. And then, yeah, so people thought I was a Nigerian. And up to now, they still think I'm a Nigerian. When I don't tell them, everyone thinks I'm a Nigerian. Yeah, I love to be a Nigerian. Yes, I'm proud. I'm proud of that. Yeah. So now next question is, how do you go about using flashcards in making them into Anki, not using them exams in 60 days? Yeah, 60 days is perfect. 2 months, exactly what I did. It was 2 months. My scores, I was scared my scores would drop. I didn't want them to drop. So what I did was, let me show you an example. I hope this helps other people. I'm going to flip my screen to UWORLD so that I show you how I do my flashcards. So first of all, you want to download the app, the Anki app onto your phone. Is $30. I think it's $28. But just remember, if you have the money, do it. If you don't have the money, then you want to use the online version. The online version is free. For me, I had the money, so I downloaded it. And if you have the money, just download it, because it's easier to carry your phone when you are outside doing flashcards versus if you cannot carry your laptop everywhere, right? So, but if you can carry your laptop, praise the Lord, like you can. So now let's go into UWorld and I'll show you how I did mine. So this is UWorld. Let me go into my previous questions. Sorry. Let me flip the screen. Good. So yeah, someone says UWorld has Anki built in it. Yes, UWorld has Anki built in it. The reason why I did not do that, the reason why I did not use the UWorld, I started it, but I didn't use that for my reviews. The reason is that I want to be able to add pages from like first aid. I want to be able to add pages from first aid like this. Let me see. Him, MNOP, GH. Let me show you guys. Sorry, I'm showing my kitchen. Okay, ABCD. Give me a minute. Let me just open to him. EFGH. Good. So this is him. As I was saying, so it is him pathology. Good. Like this. Good. So if I come to him pathology, this is what I do, like this. So now if I come to this page, because I want to take the whole page into my flashcard, so that once they talk about one thing, if I make this in my flashcard, I'm reading everything, because this topic is very high yield for both step 1 and step 2. So what I want to do is that, because I want to add pictures from here, they are not going to be, you cannot upload them onto UWorld flashcards. That's why I prefer the Anki. Okay, that is why. Now, let's see the next thing. So what someone was asking about how I did my Anki flashcards. So this is what I did. So if I come here and I'm looking for my old questions, for example, let me open this question. So these are the scores that I was getting towards the end of writing my step. This is where I was, like, it was just fluctuating between this and that. Yeah. So let me open one of my questions for you guys to see what exactly I mean. So with this, I got 78, and I want to review. Let's see how this goes. Okay, so for example, if I say head and neck squamous cell cancer, what I want to do is that if I feel like it is this, I don't remember. If I don't remember anything, I will just highlight it and take a picture with my phone, and then with the Anki flashcard or with the Anki app on your phone, you can take a picture directly from UWORLD, like the screen, into your flashcard, right? I hope you all can see. Now let's go to the next thing that I was talking about. Let's find a question that has a table. Like this one doesn't have a table. Let's find a question. Good. Like this question has a table, right? So with this question that has a table, so if I had missed this question, and I want to create a table from it, when I come here, all I'm going to do is, because I want to see the table again, I'll just ask myself a simple question in the flashcard. Maybe I'll say, what is the treatment, or maybe like this. Maybe what is the pH of maybe pleural effusion or something, or uncomplicated pleural effusion? What is the pH? If I just ask that as the question, then I'll take a picture of the whole flashcard, like all these flashcard. I'll take a picture of the whole thing and make it a flashcard, right? I mean the whole table. I'll take a picture of the whole table. And if there's anything particular that you want to focus on, then you just highlight it. You have to highlight it like that. Just highlight it so that once you open the table in your flashcard, you see the highlighted item. Now, also, I can make the screen smaller, and so that some of the explanations can also come in the flashcard like that. So I can highlight some of them and add to the flashcard so that I have it, and then I'll take a picture of the whole thing, table plus explanations, if I want to see it again. So it's like that. And if you do this, by the time you get about 1,000 flashcards, and then you are reviewing them as you add more to it, by the time you get to 1,000 flashcards, you should be ready for exam. 60 days, they should be fine. Yeah, it should be fine. So every UWORLD question, you want to add these tables to your flashcard, and then keep reviewing them every evening. Make time after studies, like just do 2 blocks in a day, and then use the rest of the time for flashcard, for spaced repetition. That's very helpful. I hope that answers your question. I hope so. Let me know if that answers your question. Sorry, I'm getting dehydrated. Okay, now let's go to more questions. Sorry. Okay, next, I'm putting information in from my incorrect questions. That is excellent. Yeah, so from your incorrect questions, very excellent. Now, next is Jaren. What's your opinion about getting a job after passing step 2? After passing step 2, like, I mean, that is a good thing. If you finish applications, you need a job to survive. You don't have to wait until residency begins. Yeah, but it's not gonna be a job like a doctor or something in the US. It's gonna be maybe physician assistant, or any other job that you can do. But a step 2 like the step 2 exam is not going to find a job for you. That I don't think is going to find a job for you, unless someone is ready to say, okay, he's finished his step 2, let me make him, like, let me employ him. Mostly it's going to be physician assistant. Yeah, I mean, I think that's the highest you can go. Yeah, but there are other opportunities too, and then there are research assistants and all that too. UWorld also has Anki built in. Yeah, that is true, which is also useful. My study partner used that also. But I like my method because I can add like the images from my book, and also I'll be able to highlight explanations and add to it. And yeah, thank you. So next one, next question says, what to do in the last month of dedicated. In the last month of dedicated, it was it was flashcards, two questions from UWorld, sorry, 2 blocks from UWorld, flashcards, and in the last week I did Amboss ethics. It's about 160 questions. You select only those ones, 160, and go through it. I did every morning. I did a block of 40 questions with my study partner. So we did about 3 days. So every morning we do 40 until like 1 p.m. We start like 9 and until 1. Then we are done. Then we do 2 blocks of UWorld like that. And then the next day we start with that again and do 2 blocks of UWorld. But also we were doing every 8 days. Every 8 days we were doing an NBME or UWorld, like an assessment, a full assessment every 8 days. Hope that answers your question. Was there a lot of biostats on step 2? Not really, not really. I don't think I can count about. Yeah. I don't think I can count a lot of biostat questions, but one way that some of the questions are framed is that they give you like an experiment. Those biostat questions where they give you, they're comparing 2 drugs and those things, and then they want one which is better than the other, or that, like they are comparing 2 things, maybe diabetic patients versus non-diabetic patients, and then they are doing that, and then they ask you a question, like questions about them. It was kind of like that, but it wasn't like maybe calculate positive predictive value or negative predictive value. It wasn't like the NBME style questions for me. In the NBME, they'll ask you, okay, if a patient has 99% sensitivity, what does that mean? Like, it wasn't like that for me. Like, for me, maybe other people had that, but I don't know. Just prep broadly, and you will be fine. I hope I answered your question. I'm not supposed to disclose anything from the exam to compromise it. That is why I cannot go into details. But yes, I would say biostat was not too much for me as was on step 1. Any other questions? If you have any other questions, let us know. Robin Hood, did you have to take a university NBME to take step? No. So my school, so usually it's the Caribbean schools that have to take the NBMS in order to qualify. And yeah, I didn't have to do that. My university is in China. They have no control over our step exams. NBME doesn't monitor my school, so no, I didn't have to do that. But I had to do it personally to see if I'm ready for the exam or not. That is what I did. Like, usually the Caribbean schools, they do it so that not everybody is ready to take the step. They don't want the performance of the school to go down. That's why they use that to assess the students before allowing them to sit for the exam. Let's see. I hope that answers your question. If not, let me know, please, Robin Hood. How would you study differently for that? For the NBME. So if it's a university NBME, there's no, I think it's almost the same as our regular NBME, because I know someone who did it, and then they feel like it was almost same. Yeah. This reminds me. Let me just ask you all. I don't know if you've heard any information about some people taking NBME recently from the university from Caribbean, where the results were suspended for the whole school. I don't know, like just within August. If you have any information, just let me know. I'm hearing something like that, and I just want to verify that whether it's possible for the whole school's NBME results to be cancelled or withheld, something like that. So next is, what would I do differently for that? I think it's the same thing. Just do your UWorld. There's no different. I think the questions are almost the same. Nothing is different. Just do your UWorlds and do some NBMEs, like do at least 2-3 NBMEs. If not, then do the shelf. At least do some few shelves before you do that, just to get yourself ready. How did you get your ECFMG certification? So I've not yet gotten my ECFMG certification. I'm not yet certified because my step 2 is still not ready, and my mini clinical exams, like mini CX, is also not ready. So I'm not yet ACFMG certified, but I'm working on getting that, and then I'm waiting for my step 2 results. So after those two, then I can get the ACFMG certification. And once I get certified, you are the first. I'll let you know. My community on YouTube, I'm gonna post it there, and I'm gonna make a video, and so that you all see it, and then that should encourage someone to also study hard, and then you'll all be there one day. So your experience with biochemistry, genetics, and biostats on your step 1. Okay. So yeah, this is a very interesting question. Biochemistry, biostat, and genetics. They are very difficult, I would say, like beginning, if you have no idea about them. Oh my God, like how can you just memorize all these things, But when you keep studying, it comes. So with biochemistry, I learned it from Dr. Najib. So if you are someone who has no knowledge, like no knowledge at all about biochemistry, don't waste time on any resource. Just go straight to Dr. Najib and learn the basic biochemistry from there, the pathways. Okay, he's gonna teach you. Go to Dr. Najib videos for only biochemistry, no other subject, please. Don't, because he spends a lot of time for only biochemistry. Select biochemistry and watch metabolism, and watch the fatty acid pathway, not everything, just the basic pathway. And be after watching Dr. Najib, you should be able to like link all the catabolic pathways, like when we start glycolysis, it's linked to the fatty acid synthesis pathway. It's linked to the protein synthesis pathway. You should be able to link all of them, so that if someone eats some carbs, it's broken down into glycogen. Glycogen goes into metabolism, but when those glycogen are some of the byproducts of the glycogen can be used to make fat. You should be able to connect that. The books don't do that, but Dr. Najib will help you do that. Now, when you get that in your mind, then the first aid will be very easy for you. Now, let's come to genetics. So with genetics, it was hard at the beginning, very, very difficult. Let me open to the genetics page. Yeah, it was very, very difficult at the beginning, but then you need to keep reading. And then for genetics, like some of the things, you have to memorize them. Okay, just have to memorize them. Like just make a rule. If you see DNA methylation, M for mute, like just remember those mnemonics. Okay, and some of the things you don't have to go so much details on it. Yeah, like this lag operons is UWORLD that does a lot of things on it on the exam. I don't think they really focus so much on it. You have to know the mutations and all that. They are more of memorization. You have this replication pathway and all the enzymes that are involved for that. You have to know them vividly. You have to memorize them and then watch videos on YouTube. For me, I would say they were hard a little bit, but they are important for you to understand the whole exam going forward. Protein synthesis pathway, you have to understand it and make sure that you know where every antibiotic works, or every toxin, the sugar toxin and the diphtheria toxin, where they work. You have to know the tRNA, the structure of it, you have to know that. And now, almighty eye cell disease. See, if you know nothing at all in this exam, eye cell disease, you have to memorize it. Like if you're not going into the exam with any information, eye cell disease, you must know it. So for the page that has eye cell disease in it, okay, that page, please memorize it very well. Very, very well. Read it a million times. I wish I had time to lecture you guys on that, because it's very important. Your ELAS downloads, and osteogenesis, I can't stress so much on that. Like, they are so important. Okay, glycogen synthesis pathway for step 1, very important. Let me not go so much into those details. Yeah, so please take them very serious. Okay, take them very serious. Or Down syndrome and co, that page, very, very serious, all of them. So let's see the next question. So I hope I answered your question there. Biostat, one important topic that you must know also is your vitamins. Your vitamins, all of them, like where they work and all of that, very important. How did you get, I didn't get that, yes. And can you talk about biochemistry, about a bit about CME form? CME, which is the CME form? And are they helpful? Or CMS forms, sorry. So the CMS forms, at the beginning of this video, I had said it. CMS forms, for me, they are not representative of the exam at all, because usually you finish your CMS forms and it takes a very long time for you to even, maybe you take them early in your studies or middle of your studies, and then you end up forgetting everything. So I wouldn't say CMS forms are so important. Just do like maybe 1 or 2 of every subject is enough, just to open your scope. But if you are doing the CMS forms and you see any question on endocrine, please take it serious. Because one thing I've learned is that NBME approaches endocrinology a little bit different from UWORLD. So if you see any question on endocrine, you want to write it down and even add it to your flashcard and memorize it the way the NBME wants it. Very, very important. So that is what I would say. But the rest of the stuff, not too much. Maybe OB, you want to take it serious because OB doesn't change. OB is the same everywhere. So yes, but for the rest of them, not really important. UWORLD and the NBMEs and the UWORLD assessments are enough for that. Yeah, they're enough for the exam. Yeah. Do we have any other question? Yeah, so yeah, it's almost the same as the shelf exams for UWorld, the CMS forms. It's almost the same as the shelf, but for UWorld, it's more like they are separating them into different subjects, and then you are just doing the questions according to the subject. So it's almost the same concept. But UWorld, of course, is more detailed. It's more detailed than the CMS forms. Yeah, so if you can do UWorld very well, and then do flashcards, as I said, if you can do flashcards out of UWorld into your Anki and take a picture of the whole thing and make time for flashcards every day. Very important. Every day when you finish studying, the last 3 hours that you are going to stay awake, make sure you do flashcards. But if you don't have the time, then you have to divide it in such a way that flashcards are done every day. Doing flashcards for me, is more important than doing questions. Flashcards are more important for me. If you can repeat flashcards, you are likely to pass than just doing questions, because the questions ask only one thing out of the flashcard, but the flashcard includes the summary of the whole topic. So yes, do flashcards every day, and then you're gonna improve more on the exam. Do we have more questions? Any other questions? You can share this, consider subscribing. Okay, click on the subscription button and also click on the bell so that when I start a new video, you are going to be notified immediately. And share with your friends, share in your groups. We need more people on board. And also, you can ask people in the comment box if you need a study partner. Just type in, hey, who needs a study partner? You all can exchange your numbers or your emails there. And yeah, you can study from there. Do we have any other questions? Okay, let's see. Thank you so much. I repeat, thank you. I greatly appreciate you and your time. I can't wait to share my experience on passing the USMLE. Yes, it's gonna happen. There was a day I was also thinking the same. I'm like, these people who write this exam, like, how do they do it? I'll be asking like, can I also do it? And then they keep coming, they're posting, okay, I got this, I got that, I got 240, I got 250, I got 230. And I'm like, Sometimes I'm even bargaining for very low score. I'm like, I just want to pass, I just want to pass. Anything is fine by me. But yes, we'll all get our fair share of of the success that people are sharing. Everybody will pass, Yeah, we'll all pass. So just keep pushing. Just keep pushing every day. Everyone is gonna pass. All you need is hard work. Don't give up. If you stop studying, then you're not going to make it, right? But if you keep studying, you will be fine eventually. Yeah, if there's any mother here, you want to drop your Instagram or something that they can watch, they can look at. If there's any mother that is studying, like just for motivation, I think, or they want to study in group, you can all share your plans with yourselves. Yes. So when did you start prepping for step one? So I started prepping for step one, I'll say in 2019, around June, thereabout. But then I made a lot of mistakes. I wasn't studying the way I should be studying for the USMLE. I wasn't memorizing stuff. I was telling myself like they are not gonna ask this. This is so difficult. How can they ask this to a second year medical student? So I wasn't taking it serious. So my whole 1 year of studies was like it was nonsense. Like there was nothing. I didn't retain any information. Yeah, and at that time also I had not yet separated myself from the world yet. I was still in the world, like um like I was still a normal person where I was going out with my friends and all that. So yeah, so the whole of 1 year was a waste. But when we came into 2020, I think around middle of 2020, like yeah, middle of 2020, that is when I realized that hey, there was more at stake and I have to be more serious. Because I remember taking, and I think I took one of my NBMEs then, the old NBMEs, and probably was NBME 20. Yeah, either 20 or 19, one of them. So what happened was I did very bad. I got like a 140. I think the three digits score was 140, and very, very bad after studying for 1 year. So it was that bad. And when I met my last study partner, that's when things changed for me. When I started studying, when she taught me like, okay, you have to pay attention to these words, you have to pay attention to that. Yeah. So 6 months may be enough to study for step one. It depends on your knowledge base and how smart you want to go about it. Okay, because with step one, every subject is kind of like difficult. Like for biochemistry, very like it's so broad that you have to keep reading for a long time to remember biochemistry. And also like genetics on its own, like you have to do a lot of reading to understand it. And like this each system is also like hard. If you are now being introduced to like hard sounds, you have to study to the point where now if they play the hard sounds, you can know, okay, is this S3 or is it S4, is this mitral regurg or is it aortic stenosis. So it's just broad. So it all depends on your knowledge base, like what you are building on. But if it's someone who has no knowledge or nothing, then I'll say maybe you should extend it into 1 year, but it's 1 year of consistent studies. Sorry, it's 1 year of consistent studies. Yeah. But if you're going to get a coach, yes, possible. My study partner, she's very smart, very, very smart, but she graduated from school in 2017, and then she studied for, I think she started from 2017. She joined the Kaplan class, which was not productive for her. She finished that. She started 2017, 2018, 2019, and then I think we met in 2020. Kind of, yeah, we met in 2020. So all that time, and then we all took our exam in 2021. So look at the time, like the time frame. Yeah, the time frame. And then she was also not like confident enough to take it until she met me. I had the confidence, I lacked the knowledge, but she had some knowledge but lacked the confidence. So we helped each other. We complemented each other's effort, and we studied together, motivated each other, and we all took it, and we all passed. Yeah. So I'm really making a point for study buddies, because a lot of people think they can just stay home and then study by themselves. You are going to make all the mistakes. You don't want to make all the mistakes. Learn from somebody, and let the person also learn from you, because most of us are English is like our third language. So if the way I'll read a sentence might be different, like the understanding might be different from how another person or a native speaker will understand it, you know. So if you learn from people, if you learn with people, then if you are making a mistake in your understanding, they can correct you. And yeah, kind of like that. So find study partner if you are struggling. If you are not that person who can study by yourself. Some people think that, oh, they can do it all by themselves. They've never used study partner, but just try it and see. If even not that, you want someone that you can be talking with constantly and be asking, hey, what are you doing this week? Are you still studying? Haven't you given up? If they have not given up, then you are also not giving up, like that. So you need someone to keep motivating you. Let's see if there are more questions coming up. Do you think we should review everything before taking the NBME step 1? For step 1, NBME for step 1. So what I usually do is that I make a note of certain things that I must review. I have them down, like there is a must before every NBME. It's a must. I must review certain things. I have a note of them, and that means that before the exam also is the same things that I must review. Like there are some topics that are very difficult, like you cannot memorize them for a long time. If you find those topics, you want to write them on something like just like a note to self like this. And so like few days before the exam, you want to review it. Like, see, this is congenital adrenal hyperplasia. I just summarized it with numbers here, because sometimes they want you to know, okay, if this is deficient, which one will increase, which one will decrease. So these are note to self. Like you want to make some quick notes that once you see them, you can remember, and you review them a day before the exams. That is it. But you don't review everything before the exams. No, not everything. And I also had some notes that, like from UWORLD notes, that I would also review. But I would have done it differently this time if I had to go into the exam again, because I would have done the flashcard so that I don't have to write UWORLD notes. Stop writing notes. People should stop writing this kind of notes, like taking notes. It's not important. Do not. Like, it's just waste of time. Say these mistakes that I did. Do not write notes, because I didn't get a chance to read any of these notes. Don't waste your time. Do flashcards and be reviewing the flashcards every day. Rather, if you have the flashcard in your phone, in your cell phone, you can review them every day. You make time. Okay, every 2 hours I have to do flashcard. Like 2 hours per day I have to do flashcard, versus writing notes. These are all UWORLD notes. Like I never got a chance to read them. So don't, please don't waste of time. Don't rewrite UWORLD, please don't rewrite UWORLD. Don't. It's not important. Put this into flashcards rather, and review them every day, and graduate from it. That's better than rewriting them. That's a lot of waste of ink and waste of time. I feel like maybe if I didn't write this note, I could have gotten maybe 10 points by just doing flashcards. Waste of time. I regret it anyway. Next one is, when is step 3 taking? When I'm taking my step 3, I plan to take it by January, like, yeah, by January of next year, 2023. So right after I start my I submit my applications, I should be like start studying for step 3. That's what I plan. I don't know if the interviews are going to be so much so that I will not get time to study for it, but definitely I want to write it before I start my residency. If I match, I want to write step 3 first. I don't want to go into residency thinking about step 3. Yeah. So I want to write it next year, definitely, but I'll start prepping for it soon. Just looking at questions randomly so I don't forget the concepts I've learned from step 2. Yeah. So kindly share the video. Kindly share the videos. And I think we've had a lot of discussion for today. Let's answer this question, and we'll wrap up very soon. Did you make your own flashcard or use? No. I didn't use pre-made deck. I used my own flashcards. As I was saying, my flashcards were UWORLD images. Is it images? Sorry, UWORLD tables. The UWORLD tables. I'll take a picture of the screen with my cell phone onto my flashcard on the phone. So I'll take a picture of the whole screen, and if the explanation is worth adding to the flashcard, I'll add the explanation also. So that when I'm doing my flashcards, I'll go to maybe the basketball court and sit on the floor. Sometimes I'll sit in the around the pool area, and I'll just be doing my flashcards. Sometimes I'll go to the university and then be walking around while I was doing my flashcards. So I did my own personal flashcards. I encourage people to do their own flashcards because that is your weak area. You only add your weak areas. You don't have to do a whole pre-made deck. And then if you do the pre-made deck, what happens is that they add everything, so it looks like, oh, there's a million questions or a million flashcards that you have to do, and you don't have to do all of them because some of them are your good areas, and it's discouraging. So start building your own flashcards at the beginning of your studies and be doing them and adding to it. Do add to it, and then by the time you graduate from the flashcards, you'll be good. And the flashcard helped me in such a way that when I came back to UWorld, when I'm doing a question, I'll just remember, oh, this is in my flashcard. This is in my flashcard. That is it. That is how it is. When you do flashcards, when you're doing questions, you just remember, oh, this is in my flashcard. This is in my flashcard, like that. And then you get questions correct. Next, most genuine channel I've seen. Thank you. Really, I don't like to fake stuff. I know a lot of people don't like me because of that. Like I don't sugarcoat things. You know, I like to face reality. Like if it's red, it's red, and if it's blue, it's blue. Like I don't make things look sweet or look nice when it's not nice. You know, yeah. So yes. I know there are some people on YouTube who make the exam look like it's too difficult, like nobody can pass this exam, and I don't like that. Like everybody can pass if they study for it. Everybody can pass. We might all not get the same score, but every person can pass this exam if they study for it. Yeah, and yeah. So and then I'm not going to be saying things like, okay, I got a low score, then I'll say I got a high score. Hey, who am I lying to? There's no point. If I want to lie to people, then I better not even show myself on YouTube and be telling lies. Yeah. Let's see. So thanks for that comment. I really appreciate it. Let's see. So I did my own flashcards. Is it possible to pass with only UWorld and just repeat incorrect until I get them right? Yes, it's possible to pass and repeat incorrect. But you know what I want is that you should do the flashcards, because why I'm saying that is that I don't want you getting this question right the next time because you've done it before, not because you've done a question before, you know, because that means that you are just memorizing the question itself. But if you do flashcards, then you know everything in the table, in the explanations, right? So that when you come back, you are not getting it right because you've done a question before, but because you've reviewed it in your flashcard. If you are getting questions because you've seen it in your flashcard before, that is perfect. That is what we want. We don't want you getting questions right because you are doing the question the second time. No, that is not a smart move. Else you are just learning the exact question that UWORLD is asking. We don't want that. When UWORLD is asking you a question, you want to learn everything around the question, not just what UWORLD is asking you. Yeah, so hope that helps. Next is UWORLD is enough. Like, you don't have to move to another Q bank. Like, UWORLD is enough. If you can do flashcards from UWORLD, it's enough. But if you are not doing flashcard, then you want to see a different perspective from Amboss, that is fine. But if UWORLD has that Amboss perspective as well, but it's in the table, so start learning the tables ASAP, and you don't have to go to Amboss. The only reason why I would say someone should go to Amboss for USMLE Step 2 is to do the ethics questions from USMLE Step 2 from Amboss. Do that. The quality improvement, Amboss has a very good notes on it. So if you can read the notes or you can do the questions, it's very good. How can I get your personal contact or email? You can go to my About tab, log in with your computer, go to About, and then you find my Instagram over there. My email is right there. My Instagram is Jerry, JERI _ 788. Jerry _ 788 on Instagram if you have one. And next, Robin Hood, thank you, brother. You're amazing. Thank you. Hope you make it for this season. Thank you so much. I really want to make it for this season. It's looking hard, like most especially this is my first time trying this, and yeah, I'm just praying that it works. I'm just praying that it works for me. I made my flashcard. I just started reviewing them. Yes, review them every day. Take your time and read the flashcard. One flashcard from UWORLD, if it's the tables, one table is worth 10 questions. If you can memorize the tables very well, it's worth 10 questions. And pay attention to everything in the tables. Very important. Okay. Yeah. True, you've really broken it down in clear English. Thank you. So if you read just your weakness and Anki cards, you can't cover the other materials. There's a good made flashcard like in physio and first aid RX. Okay, I don't know about those ones. I'm just talking about my experience, like what I did. That was fast for me. I mean, if there are flashcards out there and people have time, it's good. The only fear is that they might look a lot and they have not filtered your weak areas out. You want to work more on your weak areas, not what you know. We are not learning what we know. We are learning what we don't know to increase our score. So if it's not discouraging and then they are quality flashcards, why not? Yeah, why not? Yeah, so guys, thank you so much for being part of this today. Yeah, thank you. Yeah, it is a lot. It's a lot of flashcards. Like when I see the pre-made deck, I downloaded it all right. Like the Zanki, for example, I have it in my Anki app, but I don't do it because it's a lot. I don't know when I'm going to get through with it, But I could say maybe I know 30% of the information in it already. So I will just do my personal flashcards from UWORLD where I feel like, okay, I know this topic, but I want more information on it, or I don't know it. Let me add it to my flashcard and see it every day, and it should be fine. Yeah. Yeah. So we've had a lot today. We've said a lot. Thank you, everybody. Thank you. Good luck in marching. Thank you. Keep praying for me as I pray for all of you. It's my prayer today that everyone who watched this channel shall come back with a very strong testimony. Oh God, I'm praying that just as you have done for me, you will do for everybody who is watching me. Just as you have blessed all those who have passed their exams, I pray that you help all those who are watching me to also pass the exams. If there is anyone who is watching and that person is struggling with anything that is pulling them back from studies, I am praying that, Lord, you take the wheel and then help them sort them out, and then help them. If it's finances, Lord, you created us before money, sort us out. You are the richest. You are the richest, and you created riches. Lord, bless us with riches, and those who are also going to be doing application, I pray that you help them. Those who are going to step one, help them with wisdom, knowledge, help them find a good study partners. Those who need it, those who need just that motivation, give them that internal motivation so that they can be able to study. Give everybody retentive memory, because we can study and study and study and forget everything, but help us to be able to recollect information when we need it. We thank you, Lord. We thank you so much. So thank you, everybody, for joining me today. And it's my prayer that you all pass. I know you are all going to come back with your testimonies. And again, if you want to join me on Instagram, I'm not very good over there. I'm not really, I don't really go there. But hey, if you text me, I'll reply. Jerry, JERI _788. Jerry, JERI _788. Okay, thank you, and I'll see you guys again. I've made interesting videos also in the past about some for step one. So if you go into my channel, you'll see more videos on them as well. Okay, so thank you, and I'll see you again. Bye.